Croeso mawr I ein asylwyr ar-lein. Mae'n dda cael eich cwmni bore yma. Croeso arbennig I Professor Sally Holland, Commissioner Plant Cymru a Kieran Davidson. Y bwrdd yw corff llywodraethu Iechyd Cyhoeddus Cymru ac mae gennym etiquette bwrdd ffurfio. Gallwch weld hwn ar-lein. Mae'r bwrdd hefyd yn cynnal gwerthoedd Iechyd Cyhoeddus Cymru. Cydweithio gydag amddiriadaeth pharch I wneud gwahaniaeth. So good morning everyone, I'm John Williams, the Chair of Public Health Wales, and a warm welcome to today's board meeting. We're really pleased to have our observers online with us, and we're very pleased to have your company this morning. We've got particular welcomes to offer to Professor Sally Holland, the outgoing Children's Commissioner for Wales, and Kieran Davidson from her office. And we're also welcoming Mariana Diakova, Rebecca Clement, who's our General Management graduate, and Nathan Jones and Angela are with us for the INTP discussions. So, as the governing body of Public Health Wales, the board has a number of specific roles and responsibilities. We set strategic direction, and we have a very important piece of work on that agenda this morning, the approval of our integrated medium-term plan 2022 to 25. This also includes a review of our strategic risk, and that's relevant to the board's role around setting our risk appetite and then overseeing strategic risks. We're also today celebrating the renewal of our World Health Organization Collaborating Centre status for a further 4 years. The Collaborating Centre team makes a seminal contribution to setting our strategic direction, and we will be hearing more about the team's groundbreaking work. The board is responsible for assuring itself in terms of in-year delivery against our plans, and we have our integrated performance report on the agenda for month 11 as we come to the end of the financial year. The board is responsible for building and sustaining strategic partnerships, and that's one of the reasons we're pleased to welcome Sally and Kieran this morning. And then, of course, we set organisational tone and culture. And the board wants all staff to come into work feeling that they can be their best authentic selves without fear of discrimination or disadvantage of any kind. We also want staff to feel safe in raising concerns, either on their own behalf or because of something they've witnessed, heard or seen. We do have a raising concerns policy, and we can find that on our staff intranet. We've got a slight change on today's agenda in that we are taking under a consent agenda item a number of issues for which there's no contention and they are quite straightforward. And we're doing this as a one-off because we have such a busy agenda, and we've really got to give time to our integrated medium-term plan. So, Helen, we turn now to the agenda. Gawn ni draft yr agenda, so apologies please am ddiriadau.
Diolch Jan, Helen Bushell, Board Secretary and Head of Board Business Unit. Apology today from Diane Crone, a Non-Executive Director. Thank you.
Diolch Helen. Datgan fuddiannau please. Any declarations of interest please not already on our register? No? So thank you. So now, mae'n pleasure gyflwyni'r eto Sally Holland. Sally, it's my pleasure to welcome you again, and we're really privileged, as we said earlier. You're coming to the end of your 7-year tenure, which we know that you've discharged with distinction because we've worked so closely alongside you during these 7 years, but we're delighted that you're giving us some time this morning to share your reflections with us. So, shall I hand over to you, please?
Wel, diolch yn fawr am y gwahoddiad ac am y croeso cynnes oddiwch i chi gyd ac yn arbennig oddiwch Jan a cadeirydd heddiw. Thanks so much for this warm welcome and invitation. I'm going to share some slides, partly just to keep me to task, but also so you can see what I'm going to be talking about today. So I'm just going to do that now. And I trust that you can see those now. I'm just going to get them onto the slideshow. There we are. Please do stop me if they're either you can't see them or they're not moving along, because sometimes this happens with online meetings. But if all's well, then I'll carry on. So, just want to start really by thanking you for all the engagement that Public Health Wales has had with my office over the 7 years, but particularly over the last 2 extremely challenging years, which I'll come on to in a minute. But a special thanks to Jan as chair, who has been an I have to say of all the boards we have engagement with, the most engaged chair, meeting with me and my team quarterly and providing us with copious written updates and following things through that we raise in meetings, very promptly. So thanks especially to Jan. And just to reflect on the last 2 years before I move into more just specific child protection work, it's hard for me to choose exactly some highlights of Public Health Wales work over the last 2 years in protecting children's human rights, but particularly, of course, children's rights under Article 6, the right to life and survival, and Article 24, which is all the healthcare rights. But obviously, we've had in Wales a very successful vaccination programme, including 2 under-18s. Those are my remit, with comparator nations, unremitting success really, but also have continued with throughout that very successfully. Children's needs have been met in terms of routine immunisations and screenings in the face of everything. So big congratulations on that. We've been found particularly helpful the impact assessment work that's been done by the wider organisation. For example, the mental well-being of children and young people's impact work, and the regular public engagement surveys led by Mark Bellis. And although they haven't been of children, and we've discussed that with you, and our surveys instead have been used by you to look at impact, but of adults who care for our children as parents, seeing their regular attitudes and worries has been really vital data for us as an office. And as I've already said, very strong engagement with our office, which has continued despite the pandemic in relation to your mission to engage with children's human rights. So I'm just going to now, for the next 5 minutes, cover off what we see as a children's rights approach that we would expect from organisations like yours, and I will make some reflections on how you've been doing with that as an organisation, and then at the very end I'm just going to reflect on ongoing public health concerns for children that I know are very much in your mind today as you make your plans going forward. So we as an office have set out what we think a children's rights approach is and should be by our public services in Wales. We did that with the support of Swansea University's Children's Rights Observatory, and we expect everyone to use this approach, whether they're an individual school or youth club, right up to Welsh Government itself and all the organisations in between. And I'm really pleased to say that all of our health trusts and boards have been exemplary in engaging with our office on this issue and supporting each other to develop a children's rights approach. So I just want to remind you really as board members that all of us who care for children and young people in any kind of role, and that would include being a member of a health board or a board of a trust, you are duty bearers under the United Nations Convention for the Rights of the Child. You have a responsibility to uphold children's rights as an individual and as a member of this board. So you will all have very long CVs, and you can add this to that long CV that you are a human rights worker. So what do we expect organisations like yours to do to deliver children's rights that Wales as a nation has signed up to and committed to in our law and our policies? Well, these are the 5 principles that we think that provide a framework for organisations to make sure children get all of their 42 human rights under the United Nations Convention of the Rights of the Child. And I'm just going to go through those really quickly, Chair, to explain how they apply to boards like yours. So the first one is embedding the UNCRC, and that really is putting children's rights at the core of your planning and service delivery. And I am pleased to report that as Public Health Wales, you've made some excellent progress along this, and particularly we've worked closely with Diabetic Bowel, who's led on this work for you, but also lots of regular engagement with Jan on this issue too, to really look at how you can embed children's rights right across the organisation. And I think in a huge organisation like yours, that's the big challenge for you, because there are definitely lots of dedicated staff who really get this issue and are working hard to do it. So there's lots of different ways organisations can do that, but making sure it's written into your plans, into your strategic priorities, and into your resources is one important way. Make sure your staff are trained in children's human rights, and sometimes to make a public declaration is another way that others will do it. This is a WAST, Welsh Ambulance Services Children's Rights Promises that they developed with children, and many others have done this too. Secondly, equality and non-discrimination is a core human rights principle, and it's about thinking about whether children as a whole, so under 18s as a whole, are facing any barriers in accessing your services. And in our health services, often it's 16, 17-year-olds who miss out because they often don't quite access adult services, but don't also access paediatric services. So they're a group that I would actually take particularly to look at in terms of age discrimination, but also, as you would expect, different groups, both those with protected characteristics, but those more broadly who don't come under the Human Rights Act, such as children living in poverty. And Anir and Bevan have really worked hard on this in terms of access to their mental health services, as an example, thinking about how they can turn upside down access to CAMS, for example, so that it's not just the most resourced children who actually make it to the end of that queue to get mental health services. The third of the 5 principles is empowering children, and that's making sure that children develop the skills and knowledge to take up their rights. And there's lots of ways you can do that, and I know many ways that you're doing already as a board, involving young people in interview panels, for example, but making sure they're properly trained and supported to do that. You have a very strong programme of youth engagement through your Young Ambassadors scheme, your Health Ambassadors scheme, and I know that you work really hard on actually equipping children and young people to be your advisors and your scrutineers, because we do an awful lot, or we have in the past an awful lot in public services of quickly asking children their opinions, but not actually giving them the knowledge and skills to meaningfully take up their rights. And of course, children need knowledge to take up their rights, for example, to healthcare. So unless children know what you're trying to inject into their arm, for example, if they understand what that means, then they can't meaningfully take part in that health opportunity that you give to them. So giving children really good information about the services is another aspect of empowering, and making sure they understand where they're able to give consent, what consent means, or assent if they're not able to give consent. Participation is the fourth principle, and that's really about making sure children's views are meaningfully taken into account. So at board level, I know you're working extremely hard in this space on thinking about how you can make sure that young people are meaningfully involved in your board rather than tokenistically. And I've been very excited by the plans that both Junaid and Jan have shared with me, and just really wish you all the best in moving forward with those meaningful plans to involve young people in your board. And we already hold up Public Health Wales in this space as a good example, but we look forward to updating our case example of Public Health Wales involvement of young people with your new renewed plans as we hopefully start to emerge from the pandemic. And then the last principle is accountability. And, you know, young people must be given the opportunity to hold all of us who are here to serve them to account. And you can do that in lots of different ways. Of course, giving meaningful engagement with your board is one aspect of that. Another is making sure that young people are properly reported to about what you've done, so that in an accessible way, so that they can hold you to account. And this is a standard slide for us, so we always show other organisations Public Health Wales's annual quality statements that are developed by and with young people. And I know you've had to put that on hold during the pandemic, but I know you have clear plans to come back to it. It is really important that young people have accessible information so that they know what we're doing on their behalf and with them as partners in our public services, and that as senior leaders you're prepared to be held to account by young people, and that they understand what you've done with the information they've shared with you or the questions they've asked of you. So I think I've mentioned all of these, but these are all the things we know that you're doing to embed a children's rights approach. And Junaid, I know, is working with others in the organisation on what we call our matrix. It's just a sort of way for you to assess how well you're doing on these 5 principles and making plans from that. And I know he'll be engaging with the board on that, but you are doing, in our view, a solid job on working on these 5 principles. There are areas that we think you could work further on, of course, as we all could in our own individual organisations. So here are some things that we think you might want to consider moving forward, as well as working on that matrix and the plans that Junaid will come up with others. So we think that, you know, really working on routine engagement with your fabulous resource, which is Young Ambassadors. I know that you're working with a new group a bit from scratch at the moment, but so that you can, in emergencies, have that relationship and keep checking in and sense checking with them, which is what, you know, I've really felt I've developed with my strategic group of young people during the pandemic. I've been able to keep going back to them and saying, you know, am I getting this right? Can I sense check this call I want to make? How are things going for you with these current restrictions, etc.? So with that relationship, you'll be able to do that. And being online, of course, really helps us do that quickly with young people or subgroups of your ambassadors. Having really planning ahead for child-friendly information. I think that's got much better during the pandemic from Public Health Wales. We've had really good engagement of late with your comms team, for example, on making sure that there's child-friendly information available. But I think it needs to be planned in with all of your new work going ahead. And I think that doing a children's rights impact assessment whenever you're planning a new programme or development or policy is a way to help you really think of, well, how will we get this information out, how will we consult with young people, how will we make it reach different groups. And we have really accessible versions of doing a children's rights impact assessment available on our website, and can easily support you in doing those as you get going with them. I think that, you know, I've discussed this with Tracy and Jan several times. You know, I think that, you know, clarity for people who sit slightly outside like myself on how the governance of decisions being made during the pandemic is done is just the clarity to those of us, because sometimes I think I was being told by Welsh Government that it was a call for Public Health Wales and vice versa. I think that, again, that became much clearer, and, you know, on the whole, I just completely hold my hat up to the speed in which you as an organisation responded to and served us as a nation during the pandemic. And I think that there were times when I think we wanted to keep coming back to make sure that sort of more generic public health advice you were giving really applied well to children as well. So, for example, when you were giving advice for residential care, to really consider how that might be different for children's residential care to those of frail older people. And just to finish off, just to say, you know, this is on a slide are sort of top picks of your ongoing challenges and opportunities as a board for children's public health. So these are things that are all underway, that you're heavily involved with as an organisation, but I think that, you know, there are also lots of opportunities for you to help with the public health of our youngest generation in working alongside all of these ongoing challenges. So I'm going to, I'm very happy to answer any questions or take any comments, or to send follow-up information on any things that we've mentioned today. I'm going to stop sharing my screen now, Jan, so that we can all see each other.
Sally, diolch yn fawr am eich cyflwyniad pwysig. Thank you very much for that really important presentation. And you've raised some real challenges for us, very, very timely, as we're looking at our integrated medium plan today. We do have a couple of minutes for questions, so I'll just open it up to see if colleagues would like to come in. Any questions for Sally or comments, please?
Jan?
Yeah, Tracy'd like to come in, and I know that Rhiannon would as well. So Tracy and David. So we have Tracy, Rhiannon, and then David. Tracy, over to you.
Diolch Jan, diolch Sally Boredar, Tracy Cooper, Chief Executive. Sally, thank you so much for that. And it's interesting your penultimate slide about challenges and opportunities. We would totally concur. All of your list are on our list as well, which is good, really good. I just wanted to say a really big thanks to you. I think you've just been exemplary through your tenure, and when you, no doubt when you said yes, you didn't envisage having to really be a huge rights advocate for children and young people during the most challenging of times in the pandemic. And I think you've stayed true to yourself, you've stayed true to children and young people, and you've just been exemplary. I think our population of children and young people are really, really, really fortunate that they had you, we had you as Children's Commissioner over these, as I say, most challenging of times. You've always been exceptionally supportive. You challenge us in the right way, where you think we're not being clear. You've just come direct to us to have those open conversations, which we really, really appreciate. And it's just been a delight to work with you. Just on behalf of children and young people and all of us, just say a really, really big thank you. And I was reminiscing of the first time we met on a rainy day. You came with your bike helmet into our offices all those years ago. And so, yes, I shall miss you, and just hope we stay in touch. So just thank you.
Diolch yn fawr.
Tracy. Rhiannon, may I turn to you, please? No, David, would you like to come in now then? We don't have Rhiannon for a minute. David, over to you.
Diolch Jan. David Edwards, cyfarwyddwr anweithredol, non-executive director, a diolch Sally and the park and my wife. Many thanks. I don't know if you can hear me. I'll raise my voice slightly. I was very interested in what you had to say, and one thing that we were aware of is that during the pandemic there has been a raised awareness about health issues and public health in particular. I'm just wondering if there's any evidence you have from emerging attitudes or new attitudes to health by children and young people that will help us shape our services, or if it's something you think we could work on jointly in the future to help us mould our services to young people and direct them as they see they wish to be served.
Sally, would you like to come in on that point before I bring Rhiannon in?
Yeah, I don't think I've got any data on this, so I think I'm going to be a little bit anecdotal. Sorry, David, and I'm sort of aware of the difference, but you know, I have spoken to hundreds of, if not thousands, of children and young people over the last 2 years, and I suppose something that we're all aware of as for across the population is increased public awareness of epidemiology, I suppose, and prevention and vaccinations, etc., and a real interest amongst young people wanting to know real detail about the potential impact of different restrictions and also of vaccinations, etc. And, you know, I've never before been asked by young people, you know, I really want detailed information about how this vaccination will impact on my other health condition, for example. So I think, you know, we have seen that increased awareness and interest. You know, so I think that, you know, as a Public Health Wales, you know, you will see more demand, I think, from this increased knowledgeable generation, really, as to wanting, you know, young people friendly information about the impacts of different measures that you're bringing in. I think the other area, I suppose, that's had a lot of attention over the last 2 years that isn't specifically pandemic related, but is sexual assault and health, and young people really wanting to raise issues of you know, around safety and consent, etc., which again has got a big public health role. And that's why I put relationships and sexuality education on my list as part of the wider Healthy Schools remit that you have. And again, I think some real demand from really high quality training around those matters. So they would be the sort of 2 areas I would pick out. And, you know, my office is just really happy to keep on advising and engaging, and if where, as you suggest, possible, you know, working together on some of these issues.
Thank you, Sally. Rhiannon, final point to you, please.
I think Rhiannon's just having a little difficulty.
So, Rhiannon, we seem to be having some difficulty with your. Just try again. No, I'm sorry, Rhiannon. Can you possibly put it in the chat? I'm so sorry. We'll come back to that. Well, Sally, one of the roles of the board is to build and sustain strategic partnerships, and we couldn't have had a better, more effective strategic partnership with you and your office. As Tracy said, it's been such a privilege and pleasure to work with you over the last 7 years, and we do hope that you will leave your office with a real sense of pride for everything you've achieved and the distinction with which you've discharged this role. Diolch i chi am bopeth, Sally. Byddwn yn eich colli. Thank you so much for everything, and we really are going to meet. Diolch yn fawr.
Diolch. Rhiannon, I might have to respond to an email, I think, because I'm due to leave. But happy to do that. And I will be making my own comments, final comments on Monday at a public lecture on what devolution has done for children in Wales. So people have all the details on the front page of my website, and people are very welcome to join that online lecture, which is being introduced by the First Minister. Okay, diolch.
Diolch yn fawr. Bye now. Thank you. So we turn now to another really exciting item, the renewal of the WHO Collaborating Centre status, the World Health Organization. We're only taking a short item of this meeting because we are going to be coming back to this in much more detail in the spring. But Mark, may I hand over to you, and hopefully Mariana as well, and perhaps you'd just like to say who the two of you are as we're in public session. Diolch.
Thank you very much, Jan. I'm Mark Willis. I'm Director of the WHO Collaborating Centre and Director of Policy International Health in Public Health Wales. Mariana?
Thank you for the introduction, Jan and Mark. I'm Mariana Diakova. I'm a consultant in public health medicine and Deputy Director of the WHO Collaborating Centre at Public Health Wales.
So thank you again also for making time in what's an incredibly packed agenda. We're delighted that we are now renewed for another 4 years in our collaborating centre status with the World Health Organization. I'm going to say just a few words of introduction, and then Mariana will give you just a little bit of an idea of what has come, if you like, and what will come over the next 4 years. Your packs, I think, have the plan itself in the letter of redesignation, but the WHO collaborating centres, in a way, are their partnerships with the World Health Organization. They denote a level of partnership which is substantive. That means that we know we're working towards similar goals. We have shared objectives, and we've had a fantastic relationship with WHO, particularly with the Venice Office for Investment for Health and Development, which is our link organisation within the WHO. But it's broader than that. It might be the WHO Collaborating Centre may be associated with certain people in Public Health Wales, but it's the whole organisation supporting that particular sort of international engagement. It's a relationship we have with Welsh Government, which has allowed us to put in a memorandum of understanding between them and the World Health Organization through that. And none of that would be possible without the great work that Mariana and the team have done with maintaining, working on those relationships. So I'll just talk very briefly through this one slide here. So we're redesignated and we work globally as a WHO collaborating centre, but we work on things of mutual interest to the World Health Organization ourselves, and that started 4 years ago. We become part of a network of 800 collaborating centres. However, we are unique in the fact that we're the only one on investment for health and well-being. But even during the pandemic, we used those networks to find out what was best practice going on internationally. We're very much in the area we're working in. We're looking at advocating on policies and actions which are about future generations, investment, equity, key issues of importance to us. And of course, as I said, that allows us to collaborate internationally and look at best practice and share the great things that are going on in Wales as well. And in fact, to do that, we've now been established as an influencer nation on a European basis for the World Health Organization, which means people are actively looking at what we're doing in certain areas to learn and understand how they can take the inequalities, the equity, the sustainability agendas forward. So I'll pass over to Mariana.
Thanks a lot, Mark. If I can have the next slide, as I don't have thanks a lot. Mark has already mentioned a few of our key achievements over the last 4 years, and the main thing really has been promoting both the organisation and Wales as a nation across Europe and globally as well. This has happened through the Memorandum of Understanding we have enabled and currently delivered to, signed between Welsh Government and the WHO Regional Office for Europe in the area of health equity and sustainable investment towards prosperity for all. We have also developed a number of products as part of our work plan related to health equity. Well, established the first very innovative health equity initiative in Wales following a WHO initiative, an innovative framework. We've developed a number of guidances and frameworks and tools and publications around health in all policies, investing in prevention, investing in public health, as well as prevention of adversity and trauma across the life course with a focus on ACEs, violence prevention, and also building individual and community resilience. Next slide. And I'll finish off very quickly. We don't have much time to expand, but we will be having a focused sort of highlight session on the 21st of April. So we will be outlining more of what we've been doing and going forward. So these are a part of our future commitments going forward, very much again around the health equity, establishing a solutions platform for Wales. Also building, helping to build an economy of well-being, a very sort of new initiative together with the World Health Organization in Finland and a few other countries. And again, continuing our work around health and equity in all policies and understanding and also building capacity and resilience to prevent adversity and trauma across the life course. I'll finish here, Jan, and I know Chris, the head of the Venice office, our focal point in WHO, has sent a message, but I'll leave it to you and Tracy to share this with the board.
Thank you very much, Mark and Mariana. And as I say, this is just a taster for the board today and for us to say an initial congratulations to you all. And Tracy, can I ask you to read out the message that Chris has sent us, please?
Of course, Jan, and just to say a huge thanks to Mark and Mariana. It's both your leadership and the team that's enabled us to really move quickly into a redesignation. So I just want to read out a message from Chris. Chris Brown is the head of the WHO Regional Office for Investment for Health and Development. We work very, very, very closely with Chris, and she's a strong friend of us and of Wales. So Chris couldn't be here this morning and just wanted to give a message. So, dear colleagues and friends of the Public Health Wales Public Board, I write from Venice with my heartfelt congratulation on the renewal of the WHO Collaborating Centre on Investment for Health and Wellbeing in Public Health Wales. Never before in my experience has the redesignation of a WHO Collaborating Centre been achieved so quickly or smoothly. This is recognition of the high quality and impactful work of the Collaborating Centre and its excellent team and management, and that's Mark and Mariana. The saying that if you want to go far, go together certainly applies to our collaboration already. Together we have achieved many things with an impact in many WHO Europe countries. I look forward to this continued successful collaboration and wish you all a productive meeting. From Chris.
Oh, thank you. And what a lovely message, and so very well deserved. And you will see Mark and Mariana in the chat bar there, all the congratulations coming in to you from members of the board. We couldn't be prouder of you. And we are so looking forward to the bespoke session in April when we can find out more detail about what you're planning in depth for the next 4 years. And you'll know that your work features really prominently in the integrated medium-term plan that we have on the agenda today. So just a taster for us today. And Mariana, thank you so much for coming in from your leave to be with us. We really appreciate it. And we are really looking forward to coming back in April. Diolch yn fawr iawn. Llongyfarchiadau mawr. Many congratulations. So we are making a slight adjustment today to our agenda, and you'll see there that we've grouped 4 different agenda items under one, under a device that we have in our standing orders called a consent agenda. This is where we can take approval of items that are not contentious and on which board members have raised no issues. So you'll see them set out there. The extension of hosting to the NHS Wales Collaborative, the use of the common seal that Tracy and I made earlier, my report on matters we took in private session in January, and then the minutes and action log from the board meeting on the 27th of January. Can I ask board members, please, are you happy to approve under the consent agenda provisions?
Yeah.
Thank you. Diolch yn fawr. So that takes us on to item 6 then, which is items for approval, and one of our really, really important pieces of work today, the integrated medium-term plan for 2022 to 25. And I'm now going to hand over to Hugh, whose choreography we need to follow in what is a really substantive item. And just to say, we'll be breaking for lunch as part of this agenda item as well. So Hugh, may I hand over to you, please?
Diolch, Jan. Without doubt, huge Orchard Week. Jan, if you ever saw me dance, you wouldn't be using that phrase to introduce me, I can assure you that. So this is a huge item on our agenda each year, and there's many people in the organisation involved, and all the directors will have a contribution to make today. So it's going to be quite hard to actually make sure we do this in a coherent way. So we are going to try and work through it in a systematic way. There's a lot of narrative in terms of the covering paper, but just a couple of quick points. You know, the IMTP is a Welsh Government requirement each year, but most importantly is we don't just take it as a Welsh Government requirement. We actually use it as our strategic plan. And you'll see that the first year of the strategic plan this year has actually, I think, 350 milestones. So in those milestones, that is essentially our operational plan for next year. And directors and directorates will be establishing implementation plans below that. So that's really important. One of the points I was going to make is actually, and I'm sure Tracy will also be emphasising this in a minute, this is a transitional year. The first year that we're going into is the organisation resetting itself and moving forward. So I think that's important in terms of our mindset to move into this, and it will look very different in a year's time. This is not just the first time we've considered this. It's a working document that's been worked on for many months now. I'm grateful for colleagues across the organisation that have been working on it. directors and their business teams and all their staff have actually contributed. It's been a much easier process this year, as everybody's been very enthusiastic about the journey forward. I'm also very grateful for the contributions which our non-execs have made in the last week, having had discussions on this and the chance to view it. We've actually recorded all the comments that people have made, and we're working through those systematically. One of the things we wanted to do was just really sort of emphasise there's most probably 5 themes in those comments, and we'll address those as we all present today. So the first theme is about outcomes and indicators, how we'll be developing those. I'll pick that up in just a minute as an overarching comment. Are we clear on our system leadership role, and is this supported by our partners? So again, Tracy will pick up on those issues in a minute. Do we have sufficient focus on addressing health inequalities? But when Mark and Sally go through theme 1 in a minute, they'll be picking that issue up. Do we have an agreed sense on what we mean by delivering excellent public health services? Obviously, Meg will be picking that up. And then an important one, do we have the capability, capacity and resources to deliver our plan? I'll pick some of that up in the budget strategy part after our break, but I'll also ask Neil to pick up that very much in terms of the staffing focus. So that's what we're going to do now, is we're going to move through each of the themes one by one. After, obviously, I'll pass to Tracy to pick up an overarching comments. And I think what we'd like to do is work through those. We're assuming the plan's read. We're not going to talk through what the plan says, but in each of the directors addressing the themes, they're going to try and pick up the questions that have come out in the last week. I would also emphasise that some of the comments that you've made in the last week have already been incorporated in this version of the plan that came out on Friday, so thank you for that. And I think finally, I'd just like to say thank you to Nathan and his team. As usual, you get a very professional looking document, and it belies the fact the amount of work that goes behind it and the work across the organisations do it, so I'm very grateful for them for that. So if that's okay, I'll close there. I'll pass to Tracy for some overriding comments, and then we'll move into each of the themes.
Thank you. Tracy, over to you.
I'll echo that, Hugh, and just to say a really big thank you to you as well. You and Nathan have really navigated us through in pulling this together, and a big thanks to obviously all of the exec team and our wider team, because this, as you have people who've had a chance to read it, and obviously our non-execs have, this is our return, as Hugh said, to a much more holistic plan for us that reflects the breadth of our public health functions and rebalances what's being understandably dominated in our health protection area because of the pandemic, and trying to really rebalance that focus that covers all of our statutory functions. And as Hugh said, it is a transition plan, and what we mean by that is during this year, tomorrow, this coming financial year, we'll be reviewing our long-term strategy with the view to having a new long-term strategy that comes into place on 1st of April next year. So this plan, currently before us is a 3-year plan, may change quite considerably as it's refreshed as part of the long-term strategy. That said, this is a very clear focused plan with some very specific deliverables for us. And I have to say I'm delighted that we, for the first time in 2.5 years, we've now got a plan that covers our functions in one place. So thank you to all for that. What I would say, a couple of comments though, is that we are facing into another unpredictable year. And if there's anything we've learned, the word for me over the last couple of years is agility. So whilst it's before us for approval today, with a significant amount of deliberation and challenge that's gone behind it, who knows what is to come? We may have to wax and wane during the year, which may realise changes to the plan. But the importance for me and for us is, notwithstanding the ebbs and flows or the various surges or unpredictable geopolitical circumstances that may impact on us more directly, we still need to maintain a more sustainable approach across all of our public health functions, particularly to tackle the broader public health harms and the challenges that we're going to be facing as a result of those. So we may be coming back to the board in year to say we need to make some changes here in order to use the best resources in the best way, given the context that may emerge. And then a couple of final points. So we refer in various functions and activities through the plan as our role as a system leader. And what I mean by that is where we work really closely with our partners, and then on our occasion we become a very quiet conductor of a very valued orchestra, and that requires us to provide specialist advice, expertise, guidance, occasionally operating frameworks, just so that we can have a consistent approach on an all Wales basis for things like health protection, and for things like screening, for things like our big challenges around the broader public health areas. There are some of our activities that we would not consider ourselves system leaders in, particularly areas where we're developing our relationships, and it's not meant as a hierarchical term. It's very much meant as where we bring specialist expertise that may not exist in other parts of the system. And then my final point, Jan, is that although we are constituted and governed as an NHS trust, we refer to ourselves in the document as a National Public Health Institute. That is the term that organisations that are the same, very similar to us, use internationally. And what that means is that we have the expertise. We're very fortunate enough to have excellent expertise in the organisation that provides data, a science-based leadership, expertise, coordination, advice, and also deliver specific public health functions. So just to give a little bit of an understanding on that. So as Hugh, similarly happy to take further comments and answer any further questions, and I'll hand back to Hugh. So dear Hugh.
Thank you, Tracy. And we'll go through the themes now, and we'll pick up the feedback we've had so far. Just one point before we go into that, there's an overarching comment that came through a number of times from colleagues, which was actually about outcomes and indicators. And I think it's important that we recognise, as Tracy's just described, as a system here. And actually we can't just set outcomes and indicators on our own. We have to work closely with colleagues across the system over the forthcoming months. So one of the real targets we'll have over this year is actually in each of the pieces of work we're doing to actually clearly identify how we'll measure the impact of that. And that will be a strand running across. And you'll see in one of the appendices, we've already started to develop some of those outcomes throughout this plan. But I just wanted to make that as an overarching comment that we do take that as one of our key areas for improvement this year as we move forward. So if I go straight into the strategic theme one, and one of the comments coming across that we need to address here is about inequalities. David, I think the intention is, if it's okay, to run through the themes quickly, and then we've got a decent gap for questions at the end. Is that okay? Let's just see your narrative.
Come back at the end?
Yeah.
That's fine, good.
Thank you. So if I hand over to Mark now on strategic theme one, Mark and Sally, sorry.
Thank you very much. The way we're going to try and do this, I'll give a little bit of an overview of the elements which fall mainly within the WHO Collaborating Centre. I'll try and touch on some of the questions we already know about. I think, Sally, you're going to then fill in some of the other elements. And hopefully between us we'll have touched on everything, but we'll do a quick mop-up. We know we've only got 5 minutes, and I probably only already used a minute. So this is very much enabling better population health, reducing health inequalities, and I think people that have already pointed out, is inequality strong enough? Additional element has been added to the introduction overview on that, just to pull it together, and I think that then relates very well to the fact that I think inequalities itself are referred to more than 60 times throughout the document, so it's peppered throughout the document as well as now pulled together in the beginning as well. Another element I think is about the ambition, and I hope that this particular chapter or theme comes through very much from my perspective anyway, on our role and as advice and as advocacy. And where we can do the supporting, but we recognise that we're doing that with others. And again, in the beginning of the document, you'll see extra reference now to the need to influence the system, but we'll be doing, and you'll find in there a huge amount around health impact assessments, adverse childhood experiences, behaviour change in the behaviour change unit, policy support around well-being and future generations, which is inequalities and young people and the socio-economic duty, the policy and the advocacy work around COVID, Brexit and climate change, the work plan of the World Health Organization, collaborating centre jointly with them, the tools we mentioned briefly before, that life course view as well, and international as well in there, and our ability to be an influencer and to gather the most. And we will be continuing things we've learned during COVID about how best to gather information internationally and link that in with what we're doing in Wales, as well as links within Wales on things like criminal justice and other sectors, housing. And again, they're prominent in there with our advisory, training and recommendation side being a key element. I think I've just finished by saying, is there enough of all those things? The truth is probably not, but there is a trade-off. You know, there is a limit to what we can do on what I've just described as just part of an enormous agenda. But we hope we've got the balance right in terms of trying to covering those. And I know, Sally, I haven't touched on the services or the primary care, so perhaps over to you quickly for that, if that's all right.
Thank you, Mark. I'm just going to add I'm really pleased about this plan. I think it's very well summarised on page 17 for me, around what it is that we're trying to do, and I think that just the breadth and scope of all the planning work that's gone into place is very helpfully summarised. So it's not that we've just put these things out there and then we've got a lot more work to do. Actually, this sits on top of an awful lot of planning already, so we may need to finesse that. But it's largely sitting on top of something that's really important. I think it would be remiss of me if I didn't say that, you know, there are elements and characteristics of this theme which are dependent on as restarting things, because much of the resource that came from the Health and Wellbeing Directorate was redeployed in the pandemic and has really just only started to come back. So there is something about that just sort of general nature of planning, which is what can, you know, in terms of the resources that we've got. And I think that's provided a real opportunity for us to think about doing things differently, being more innovative, pulling together and maximising the assets that we've got across the organisation. So we're not a silo, that we're working across with others. I'm particularly thinking about innovation with our tobacco plan, where we're working with Ian and his team. We're bringing in behavioural science that we always have done, but maybe accelerating that a little bit more. And these are opportunities for us to collaborate, not just within Public Health Wales, but across now with a system which we do sense is much more engaged, invigorated, and that's really important for us. And it's a real impetus for us particularly in that health improvement space. I do take on board some of the comments that I've received so far. I think there is something around the wider determinants. Perhaps it isn't as clear as we would like to make it, but I think we're clear in our mind that we're what our role is. But perhaps we need to look at that wording again, and that's, you know, and clarity brings momentum. That's one of my catchphrases. So anything around that, very, very happy to do things around that. I think I think in terms of the behavioural change aspects, this is a really important aspect, and we know that there are points in the plan around the unit, but I just wanted to clarify for the board that we use behavioural science is embedded and has been for a number of years in our work going forward. So it isn't completely new, but accept that the entity of a new unit does have some development aspects. And then I just think, just finally, I would like to sort of pick up on the innovation point that I've said before, which is, I think it's one of those words that probably means a lot of different things to different people. But I think the characteristics of innovation around it being new, about having a sense of dynamism, having been worked on collaboratively, having real-time information, all of those aspects, I think if you break it down, sort of our plans, I think, do reflect those characteristics of innovation, and I'm very happy about that. But I think what we will be doing and will want to do going forward is to showcase some of this to the board over time.
Okay, Thank you very much. And just picking up a few comments in the margin there, we'll try and run through, because I think there may be comments from colleagues in the board meeting which will overlap from more than one theme. So we'll save all the questions to the conversation discussion part at the end. So I'm going to now move on to Meng, if I could please. And some of the challenges that's come in the correspondence last week is explaining what we mean by excellent public health services. And our plans for recovery and performance of those, are they ambitious enough? So that's the things that some of the things Meng will address. Thank you, Meng.
Diolch yw Pnawn da pawb, Meng Cordwy, National Director for Health Protection and Screening Services. And I think this, inclusion of this theme to deliver excellent services for population screening programs, health protection and infection is a real impetus for us to focus on how we deliver those services from Public Health Wales. And this is direct delivery to people in Wales, as well as providing diagnostic facilities in the laboratory network that Public Health Wales has. And this represents over 50% of the workforce and budget for Public Health Wales. So it's a significant endeavour that if we didn't have an ambition to deliver excellent services, I think it would be missing then from our narrative for what Public Health Wales does as an organisation. So it's an opportunity for us then to set the bar really high, and in trying to capture a word that describes what our ambitions are, I think excellent is a good word. But however, we need to define what we mean by excellent. And I think we draw on the work of Don Berwick in terms of quality of healthcare and look to 6 aspects of excellence and health service quality to start our thinking around this. So safety, effectiveness, patient-centeredness, timeliness, efficiency, and equity are those components that we will aspire to. Now that the COVID response has abated to some extent, it allows the Directorate Leadership Team, which will be configured in its new arrangements from next Monday. I'm delighted that we've got additional capacity in the Deputy Medical Director and also an Assistant Director of Operations, who will then complement the team to take some of this thinking forward. So what I've asked the team to think about is in the 3 key service delivery areas, how we use those structures of excellence to describe our ambitions, to devise a list of success measures against all our IMTP ambitions, so that we've got a clearer thinking and we can construct a performance indicator to marry up with those 3 key service functions. So I hope that gives sufficient narrative at this stage, just to say that it's still work in progress, how we define more specifically what we mean by excellent services. But the assurance is that when setting our ambitions, we want to be over and above the expectations of industry-leading experience, so that for each of the 3 service delivery areas, we can describe that in a little bit more detail than what you see presented in the IMTP. But the details of the milestones for each of the quarters is in the report, and I won't repeat those. So I think I'll stop there, and hopefully that gives people an overview of the ambitions for this area of delivery.
Excellent, thank you, Meg, and thanks for keeping within that tight time. If we move on to John now, who'll pick up on theme 3.
Thank you, Hugh. Good morning or good afternoon, everyone. John Bolton, National Director of Quality Improvement, Patient Safety and Director of Improvement Cymru. So theme 3 is very much about raising the profile of quality and patient safety and recognising that this is a real significant area of challenge for the system as we start the recovery process. And I think we as a public health institute have a significant role in supporting that harm reduction and patient safety agenda. You'll all know that just over 6 months ago, Improvement Cymru adjusted its strategy, and there was a real desire to more clearly represent that strategy within the IMTP, and I'm really pleased to say that we've achieved that. It's ambitious, but I think it's clear and very focused in what we're trying to achieve within this theme. I think one of the things that we are very keen that we want to do is not just to better be able to demonstrate impact in the work that we do. So evaluation is a strong component of the work that we've got within this theme, but equally at the same time, is that as you'll see through the theme, there's some really quite significant, impactful pieces of work that we want to make sure that we've got within the IMTP. We've a number of milestones, but I think, as I've said, whilst they're ambitious, I do think that they're achievable. It is dependent on us restarting our work. We have started to restart the work within the directorate, but I think equally at the same time, it's still challenging bringing back a team that were fully mobilised through the pandemic and actually rebuilding that infrastructure. And I think the other thing just to recognise, it's also dependent on organisations being ready to accept the offers of support, when at the moment is that they're still heavily challenged by COVID, but also the recovery process. We have a strong focus on patient safety within there, but one of the things that I recognise is that when I describe patient safety, I'm also considering backlogs, and I know from the Minister's perspective, backlogs and waiting times is a significant area of focus, which we'll also be supporting and working on.
Okay, thank you very much, John. Now on to strategic theme 4 and Ian, please.
Yeah, thanks. Strategic theme 4 is maximising the use of digital data and research to improve public health. And looking at this from the perspective of this is how I enable the other 3 themes to be delivered well. Sally picked it up about talking about how we work in partnership with her in order to deliver innovation on tobacco. But equally, there's things in there like several commitments for services to employers. Digital comes in by us spotting the common thread and developing the excellent service together across it. And equally, Meng picked it up around what does excellent public services do. Excellent digital is really about patient engagement, public engagement, and developing services they love. And so I view this as being the golden thread of the digital, the data, and the evidence, which sits through many of the different aspects here. The comment I had particularly to pick up on here was on digital from the minister's side. And I think I understand where they're coming from, and some of the reassurance here is that it's embedded right the way through how we do it and how we pick up on it. But equally, I would say that we can't suddenly magically go from where we're at to being completely digital embedded overnight. I'm only too reminded of the anecdote of somebody who tried to do that with lawyers and giving them all iPads to get rid of papers, and discovered the lawyers at the photocopier with the iPad face down, getting photocopies of the court papers ready to go. And so the plan in my mind is trying to strike that balance between getting digital ways of thinking embedded across the plan and enabling it. And a lot of this is on how we work and how we take forward the commitments right the way across the plan, but equally not trying to run so fast that we end up creating perverse incentives along the way. Thanks.
Thank you, Ian. And the final theme then is enabling delivery. As I said, we'll pick up after the lunch break the budget strategy, which is a key part of that. But I thought it'd be sensible now to ask Neil to come in here, because obviously our workforce is so important to delivery of this strategy. And one of the queries and challenges that we've had in the last, from our colleagues is, do we have the capacity, capability, and resources to deliver the plan? So Neil will address some of that. Thank you.
Thanks, you. Good afternoon, everyone. Neil Lewis, Director of People and OD. Yeah, in terms of the enabling delivery piece, I think it's a key, obviously, element in terms of the IMTP and the plan as we move forward. I think the capacity and the capability to deliver. Clearly, I think we've talked extensively already this morning around surge capacity and change in this space. I think clearly there's a number of points I guess I would just highlight. I think there are some challenges absolutely in terms of recruiting and retaining the level of workforce to deliver some of these areas, and especially given some of the skills shortages and some of the expertise challenges that we face across the NHS in Wales, but more broadly. One of the things we are going to do in this space, colleagues will, and I've quite rightly picked up on some of the change initiatives. There are quite a few areas that we're looking to progress, especially this year. We are prioritising, as colleagues will be aware, the local public health team transfer and the bringing together of the directorates. We will then also look at having a single governance structure to ensure that everything from a change perspective is managed centrally in that space, and would suggest that Podcom, and I know Mohammed and I have had some conversations around that, are sort of will certainly assist in that that area and assist in that space as well. So I think certainly from my perspective, our perspective, I am confident from with the current position that we are able to progress in this area. I think it is, as has been suggested at the outset, something which we will have to review throughout the year as challenges, potential surge kicks in, but certainly from a resourcing perspective and with the new people in OD structure, I am content and confident that this is something which is absolutely achievable moving forward.
Thank you, Neil. And Jan, maybe my dancing's improved a little bit because we're a little bit ahead of schedule there. So I think the idea is I'll hand back over to you. We'll take questions, comments. One of the things we need to do today is hopefully approve this IMTP, but also if there's any changes that people want to make and we agree that we make before submission to Welsh Government tomorrow, we need to agree that as well. But I think in terms of the approval, we obviously need to do the risks and the finances after lunch break before we do that. So thank you, Jan.
Thank you very much, Hugh, and thanks, colleagues, for your brief overviews there of the different strategic themes and the enablers, but it's given us a sense of the big picture issues and how the issues raised to date by non-executives and others have been incorporated. So, Hugh, shall we take any questions, comments against the strategic themes? That be a sensible way of structuring?
Okay.
Yes.
Yeah, sure.
Is that? Do you think, or did you have a different plan?
No, I haven't got. Seriously, Jan, I was open to however people want to raise their questions.
So would comments against strategic themes be helpful? Or before we start that, are there any general overarching questions? David, is yours a general overarching question? Yeah, so we'll take any general points then, please. David, Johnson, thank you.
Okay, good morning, Jan, and thanks for all the work that's gone into this. I've got two general questions. One, I think is going to probably be quite a pet question for the next 12 months, so that's a warning. Had we written this plan 2 years ago, what would be different? Or if we put it in reverse, what are we doing different now because of the 2 years and more we have been through? And I'm saying that in a positive way. If you can point us towards the learning and the experience we've gained, which has impacted on our strategic thinking. And just secondly, this is a 3-year plan, and it fits nicely with the 3-year financial planning as well. But we know that many of the outcomes we're looking for will not be achieved in 3 years. The big question, really, it's a difficult question, but can we be assured that the 3-year planning will help us achieve the more long-term goals? Because if we can't get that assurance, we will waste the 3 years. That's a big statement. I know it's a challenge, but I think it's important where we are now that we get right what we can get right.
Thank you, David. Diolch. And let's take all the general questions now then, and answer those at the start. So, Mohammed, you have a general question?
Yes, I do, Jan. Diolch yn fawr, Mohammed Mehmet Dwi. I'm one of the non-executive directors. Hugh, my general question is on what success looks like. I think that's sort of summarized on, I can't remember which page it is now, but right at the front of the document. And I just wanted to raise the point about ambition and whether this is ambitious enough. So it says that there are 2 measures of success. One is that we will restore to pre-pandemic levels. And I'm wondering whether it should take 3 years to do that, and whether we should be more ambitious in terms of being able to provide what we did before the pandemic. And I assume that doesn't even take account of the backlog, or maybe it does. So some clarification on whether that is an ambitious expectation. And the second is that we will have improved relative to this baseline, which I think is an expression of ambition. But
can we say a bit more about what that means, and how we will know?
Thank you. So do we have any other general questions? Sean, you have a general question? Do come in.
Thank you, Jan. I think it's general. I thank you, team, for all the incredibly hard work and thinking, and I know it's an ongoing thing, but I just wondered how we influence the public health contribution of others, because we don't deliver public health on our own. And so, for example, I'm thinking primary care, I'm thinking healthcare system, I'm thinking, and it does take you into the wider determinants, but I think that's really around both the areas that Meng and John discussed. And I don't expect a quick answer, but I think there is something there about enhancing the public health role of others in promoting the public health of Wales.
Thank you, Sean, and that very much follows on from Frank's point this morning, wasn't it? This is a moment for public health and for leading an integrated public health system. So,
and Jan, I'm reflecting on the comment you often make about how you're the lone voice in the room talking about the inequalities or the public health.
With my chair colleagues. Thank you. Although I do have to say that there are chair colleagues who get this agenda.
You're winning them over, yeah.
Yes, yes. Thank you. So, Hugh, shall I turn back to you then in terms of the general questions?
Thank you, Jan, and I'm sure colleagues may want to help me on some of these. Actually, I think to some extent, some of what David has said and Mohammed has said are actually very closely linked. If we'd written this 2 years ago, what we'd have done differently, and is this ambitious enough? I mean, I think that they're almost two sides of the same coin. And I know Meng will come in terms of some of the recovery issues and in screening and what that actually means. David, what would we have done differently 2 years ago? I think you've heard some interesting comments there. I mean, first of all, we started with Sally and Mark giving an integrated and a combined view in a much more focused way. And I think that relates to some of the learning in terms of as an organisation. One thing COVID did is make us work very closely across the organisation. People became less concerned with where they originated from and more working together. So I think that's an important part of that. Ian talked about digital as being a golden thread. I don't think we were there 2 years ago, and I think that's very much come to the fore. John talked about the improvement Cymru strategy, and I think that's important for us as well, because that's been through chairs, chief execs, Welsh Government, and again, that's something very much in the last year. So all of those issues, I think, show us in a very difficult, and I find it quite difficult to actually say what the real difference is, and I know Tracy may come in a minute. In terms of the outcomes issue you raised, one of the things we've got to do in developing our outcomes is also look at what indicators support them. And therefore, we won't be looking at outcomes in isolation, that we can't, that they will only measurable in 3, 4, 5 years' time. There will be indicators which would be giving us the feeling whether things are moving in the right direction. Much of what you considered as your performance report in the past is historic, is what we've been asked to report. So some of the work we'll be doing this year is looking at that in a different way. So I think those are important. Before I pass on to colleagues, the point about ambition again, for me, I can't stress enough, this is a transition year. We are still dealing with the pandemic at the moment, and as colleagues have talked about, there's an awful lot of work going on with Ukraine and the war at the moment, and the implications of that. So actually, we have to be careful with our ambition. I think it takes us to a much better place. I think it's much more ambitious in terms of where we're going at the end of this period than we were before the pandemic, but that's my personal view. But I think we've got to be very careful. We've got 350 milestones in year one. To me, that's a pretty ambitious position to be, and that is pretty demanding, and that links to what Neil said. But actually, again, it's very subjective. So I know Tracy and Meng have both indicated they wish to come in. So maybe if I finished on the ambition point, it's best to bring Tracy in on that first, and then we'll go to Meng in terms of the recovery points.
Yes, thank you very much, Hugh. And David, just to bear in mind that this is a rolling INTP. It rolls forward every year, so it's not 2025 stop. It'll be rolling forward. Thank you. Tracy, over to you.
Yeah, I think that's an excellent question, David, about what would be different. So I just got a couple of additional points to use. I think it's a much stronger, more authentic and deliberate focus on our staff, on health and well-being in a way that, yes, we've made comments before, obviously it's always been important, but it's intensely important for us. So I think that's much stronger. I absolutely concur with you around the data shift, and obviously Ian joining us is just also a helpful disruptive thinking and leadership on that. I think it also plays more than ever than 2 years ago to ensuring that we've got a system of resilience in order for us to be better prepared to respond to threats that we haven't anticipated or have anticipated. And the investment that we've had, to be fair, from Welsh Government, the health protection microbiology, puts us in a much stronger position to take those shunts, but not to be completely offsided by them, but be able to be really resilient and flex as needed. And on that note, I think it reflects a much more agile ambition, and we're more open about the need to hold it subject to review, because it's just an interesting time. And the last couple of comments from me, I think it's much stronger on climate change, perhaps. And we've made before, we've got reference in the plan is, whilst we've got quite a lot in it already on climate change, we need the next number of months to really work out what's our USP on climate change, and that will be very clear in the long-term strategy. And then the final 2 points, I think, given the extraordinary way that partners, particularly public service partners, but not exclusively, have worked over the last couple of years, I think it's much stronger in meaningful areas, particularly with local government, that we perhaps we would have envisaged a response or a reference to, but not how we can really work with partners to identify how we support them, and probably less so the third sector, but that broader public sector partnership, I think, is much stronger than we would have envisaged in it. And the final point is, I think in the last couple of years we've worked so closely as a broader integrated public health system, I include local authorities in that, that I think it's a different tone of collaboration, of how we work things through together. For example, the healthcare public health, we've got a lot in the plan around healthcare public health, but we need to work out what does that leadership role, and we wouldn't dream of doing that without working with Welsh Government and Directors of Public Health Force partners in that. So I think that it's just the behaviours of the system and our views and how we work in a much more equitable way, I think is much more prominent than we'd have envisaged it being if it had been 2 years ago.
Thank you very much, Tracy. And we've got Mark and Meng who both want to comment on these general points. So Mark, shall I turn to you first, please?
Thank you, Jan. Yeah, just some practical examples for David's questions. We learned that people were really keen on knowing what was happening internationally. An incredible thirst for learning very quickly, and in the IMTP you'll see that we are going to continue those updates on what's happening internationally on a regular basis, sharing and gathering what's happening in different countries. You heard from the Children's Commissioner that the public survey has really been, I think, identified a gap which we in many ways we should have known was there but didn't, where so much of our data has been driving in a rear view mirror, but people want to know as quickly as possible what's actually happening now. So we'll be continuing that theme of that up-to-date data for the Welsh Government Commissioners, the Welsh Government themselves, Public Health Wales, and a whole range of other people. And I think my other comment on that change is it's also brought us together with other sectors, and there's a stronger element around working with criminal justice, around things like abuse and neglect and what's happening in people's families at home, and I think that's something that's in there. And then to Sian's question, I think we've also got, in terms of influencing other people, we really need to, and we've got in there the tools on health impact assessment, which bring together people in the local authorities in different aspects of different trusts. We're building tools in there which are about empowering other people, which allow us to amplify the work we're doing. And we really are throughout this, trying to inject behaviour change as well. But of course, starting from a low base, so that will take a bit of time. But even in the first year, there are some ambitious plans in there, because I think, and linking the two together, one of the real bits of learning there is there's no point going out there with really complicated statistics and messages that people don't understand. What came out in COVID is that there is a genuine interest if people can see the numbers, understand what's happening and understand what's being asked of them. And I think that's all about understanding how we use behaviour change.
Thank you, Mark. That's really helpful to have those practical examples there. And Meng, would you like to round off the commentary on the general questions, please?
Thank you, Jan. So in addressing the general questions, I'm going to use the specific example about service delivery and how we incorporate our thinking on recovery of particularly our screening programs. As colleagues will know, we paused it for a few months in 2020 and the services are still being recovered. Part of it's within our control, part of it's outside of control. A specific example of that is bowel cancer screening, where we rely on our services in the health boards to provide screening colonoscopies, where there is currently a burgeoning waiting list because of the pressures on the system outside Public Health Wales. So I think we need to inject a sense of realism and uncertainty into some of the targets and ambitions, so that we have realistic targets. But the ambition is very much to revert to what we had before and go beyond what we had before. But the realism is that in order to be able to do that, we need to rely on some other services being recovered. So it may be, it would take a year or two before we even get back to the 2020 position. In terms of partnership working, I'm always in favour of form following function. So in restructuring or reconfiguring the directorate leadership team, we've enabled portfolios to focus on how we nurture strategic partnerships. And I think this builds on Sian's point that we can't do this alone. So our work, for example, on healthcare associated infections, where the metrics aren't heading in the right direction, is about our leadership role, working with health boards, working with medical directors, directors of nursing and directors of public health on how we address it as a whole, because antibiotic prescribing and also how we deal with infections in hospitals is absolutely key, and we can advise and support, but we can't actually do at the coal face. So by formalizing this as one of our directorate high-level objectives, so one of which is delivering excellent services, which I'm pleased to say is now also one of the strategic objectives for the organisation. The second is about developing a multidisciplinary and engaged workforce. So the workforce needs to recognise that actually excellent service delivery is at the heart of our ambitions for the directorate. And the third is how we nurture integration and strategic partnerships. And we've got people with portfolios around developing clinical partnerships and also developing public health partnerships. And I think through those two portfolios, we want to really formalise how we do that to enhance our service delivery. So by having that formal process, we can then track and monitor. And I will want to have clear narrative about how we as a directorate will deliver our services against those ambitions.
Thank you very much, Meg. Now we will capture in the minutes all the influences, impacts of the last 2 years on this planning process. But Hugh, I will leave it to you and Nathan in terms of any changes to the text, to the plan. But in terms of noting, we will capture it in the minutes. So if we move then to strategic theme 1 that Mark and Sally took us through. Mohammed, did you have a question on the wider determinants of health in relation to this strategic theme?
I did, and also on the inequalities, if I can deal with both of them. I mean, first of all, I wanted to say that I really like the way that the commitment to tackling inequalities is weaved through the whole document. I think the debate about whether it should have been a separate, separately handled theme, or the way it has been settled very clearly, and I think that it reads really, really well. I think what I would have wanted to see, I suppose, more is some specifics about which inequalities we would tackle and some numbers against that. I think that would sort of bring it to life a bit more, and if that's available, I'll encourage people to do it. On the wider determinants, I think somebody's already mentioned that we need to do a bit more work on this, and I think this provides an opportunity for us to develop some of the strategic partnerships we already have. Local government has been mentioned, and other organisations, and I was thinking particularly about references to the educational gap, which has been identified as one of the key themes for us. But there is an educational gap that refers to the gap between Wales and other European countries, and there's an educational gap that relates to the educational gap within Wales, between deprived communities and others. And it isn't always clear which one we are referring to, and I think we need to maybe think about that a bit more. And there's also a great opportunity to talk to people in Welsh Government and the regional education authorities, which are also really engaged with this issue. And perhaps our role here is to support through some really powerful research rather than attempt to lead on an issue that maybe others are a better place to do. So you know, that might apply to other areas of wider determinants, but it's great to see it being reflected so clearly in the report.
Thank you very much, Mohammed, and we will make sure, Mark, Sally, Hugh, etc., make sure that in terms of what can be reflected before the plan goes in, will be, in respect to the points that Mohammed has made there. So I'll move to strategic theme 2 now then, and Meng has very helpfully given us already some further detail around this strategic theme, and particularly the definitions and the use of Don Berwick's dimensions there, which is really helpful. Anything further for strategic theme 2 at this point? Kate, dros y chi.
Fawr Jan, fawr mewn Kate Eden ydw I is-cadeirydd ac wyddwr amaethredol. Kate Eden, Vice Chair and Non-Exec Director. Thanks very much, Meg. I think you probably answered my question in part already, but I think you probably expect me to ask this question about our screening programmes. I'm really struck, actually, by the ambition included in this plan around the recovery programme for our screening programmes. And I think, you know, we've talked a lot about this being a transition year, but when I look at the milestones that we've included for our screening programmes, I think it's more of a transformation year, because by Q3, we're saying that our screening activity levels will be higher than pre-pandemic for breast, AAA and diabetic eye. That's a huge ambitious target. And I can see here the ways in which you set out how that will be achieved in terms of increased staffing, increased venues, increased capacity, etc. But it's still really quite a stretched target. So I'm just interested in asking you really just to expand on some of your reflections around how we'll be tracking those milestones, because in my role as chair of the Quality, Safety and Improvement Committee, obviously, you know, we will be looking to hold execs to account against this plan. So I would just be very interested in how we're going to track that, what tools and mechanisms non-execs will be able to use, and what assurance we can be getting on that trajectory. Thanks, Meg.
Diolch, Kate. Meg, do you want to come back on that point now?
Yes, please. And, you know, I think it's right that we set our ambitions high, because screening programmes are very important in terms of the population health outcomes in Wales. The team is tracking the recovery and progress in recovery on a monthly basis, and at any time we're able to share a progress report of that. And in fact, we've got a BET paper coming up that will share some of the updates on recovery. So I know that the screening team led by Sharon has that regular updates. You are right to point out that this is probably a time of huge transformation and therefore huge change. And the knock-on effect of change is that it might well distract from ability to actually improve uptake, etc. But this is where I think our working in partnership with others is really important. We've already seen some benefits in engaging with the National Endoscopy Programme around bowel cancer screening colonoscopies, where our wait times have reduced in recent weeks because of the national advocacy, resulting in the CMO sending a letter to health boards and actually introducing the notion that a positive test result for bowel cancer is suspected cancer, and it should therefore be connoted as part of the cancer referral pathway, and all the metrics to track that are then included as part of performance. And we've seen some significant reductions in waiting times for colonoscopy. We've also had innovation around offering FIT testing for symptomatic cases, not just for screening, and that's meant that we're able to triage out those who don't then need a bowel colonoscopy, which then has a knock-on effect of releasing capacity for bowel screening colonoscopy. So that's one example where I think innovations and what we do in partnership with health boards have created a space for us to improve our position. The second one, which is much more live, is around diabetic eye screening, where we recognize we need to transform the service, review our service delivery model, because what's brought this home is the loss of venues as a result of the pandemic, from over 140 venues down to 40 venues, which limits access by people who need diabetic eye screening. Now, we've been innovative to try and find additional venues to mitigate that, and we've done that in part successfully, but there's more to do on this, which is why we've established a transformation program for diabetic eye screening to really look at the service user experience, and Ian Bell's input and leadership on the digital aspects of this. A discovery program will enable us to understand what the best model of service delivery is going forward. So it is transformation in progress. And there are other innovations that I've recently learned about, such as green fleeting our vehicles for AAA screening, so that we can also make an impact on our carbon footprint in that way. So lots of examples, but I suppose in answer to your question, I come back to a need to inject some realism and also some uncertainty, because COVID may have twists and turns that will then subsequently have further impacts on our ability to deliver against our ambitions. But I think it's right that we aim high, but the risk of that is a failure to deliver against those ambitions. But the assurance I'd like to give members of the board is that we are tracking this on a regular basis, and this is coming up to the Directorate for review on a regular basis as well.
Diolch, Meg. And Kate, I'm sure that in 22-23, QSIP will be really looking at the indicators that you want to take assurance on behalf of the board in respect of these milestones. And I think what you've just described, Meg, actually speaks to Mohammed's point around improving against the baseline of the pre-pandemic position. And it isn't just going back to that, is it? Because as Meg has so eloquently set out, there have already been real service transformations and innovation, and we need to reflect that, don't we? So perhaps there's something in the text there, Hugh and Nathan, if you could just reflect that. So Judy, I know you want to come in on this before we then move on to strategic theme 3. Croeso mawr, Judy.
Diolch, Jan. Judy Rees, Non-Executive Director. My first point really was that it is an excellent and comprehensive plan. I just wanted to say that, and I also wanted to say that it's really important to focus on those inequalities and really focus on the ways that we can improve the way that we tackle them. And in particular, I think looking at the screening, I think for me it was about yes, there are statements in there about improving that percentage, but we absolutely need to work harder on doing that and lessening those inequalities. I particularly though wanted to focus on the bullet point that was in there around the initial focus around planning and scoping work on lung cancer screening. It was really pleasing to see that in there, although I'd also like to see it if that's possible. And I think it's really important that we start, as public health starts to plan for that inevitable rollout following the UK National Screening Committee's draft recommendations, which I know will be reporting in June. And I would just like to say also that I think Wales, well, this is a targeted screening programme rather than a general screening programme because of the incredible expertise that Public Health Wales has in terms of running screening programmes. For me, that would be the desirable lead. Of course, that would be resourcing. Of course, it will. But I do hope that that will be reflected in the plan as it develops.
Thank you. Diolch, Judy. And we will ensure that where it's possible to include before the plan goes in, those specific references you made. Nathan has been making points of those, so we will reference them accordingly. Diolch and Fawr, Judy. So if we move on to strategic theme 3, and remembering that the board has previously seen the Improvement Cymru strategy before it went into Welsh Government for approval, is there anything in addition to the issues we've already raised on this, and John has flagged this morning, that anyone wants to raise? No? So I think we can move on then to strategic theme 4. And again, Ian has set out very eloquently really where our level of ambition, but the realism we have to have in terms of the work we have to do to progress along this very exciting but complex agenda. David, did you want to come in there?
Yes, briefly. As you say, I think Ian captured it very well by maybe emphasising the practical ambition we have to have in this space, and you talked about that we're in a different place now where we were previously. I'm just thinking how we monitor progress, and maybe one thing that committees can do is to look to see how we mainstream digital very much from the service user aspect. I think that's probably the most challenging place, but it's the place where we can make most gains. So that could be something for committee, so that it really is mainstreamed across the organisation, and perhaps we can reflect on that.
So that's a really important point, and it's certainly something that Ian and I have talked about in terms of us being a trusted source of support and data and advice for the public and users of our service. So that's a really good point that we will build in there. And then finally, before we break for lunch, anything in respect of the people enablers that Neil has highlighted for us, and remember that we do remit to People and Organisational Development Committee the detailed oversight and assurance on this agenda. Anything for people enablers? No? So I think then, Hugh, this is a sensible time for us to break. And we now have a 25-minute break before we resume then with the strategic risks and the budget strategy, which will conclude our work today on the IMTP. Okay, so in fact, could we come back at 1:30, please? I know that's 22 minutes, but if we could do that, then that enables us to stick to time. Diolch yn fawr. Okay, thank you. So break to 1:30, please. That was an important point, though.
connecting.
Can we get rid of
Okay, croeso nôl, welcome back. And we are continuing with the agenda item on the integrated medium-term plan. And we're moving to look at the strategic risk section. Now, of course, the board regularly looks at strategic risks, and those of you who are regular attendees at our meetings will know that. And the board does have, in its May meeting, a specific agenda item on strategic risks as well. So, Rhiannon, we're not looking to a detailed overview of the risks today, and everybody will have read them. So if you'd just like to make a very brief introduction, then I'll ask if there's anything that anyone wants to raise at this stage, please. I'm glad you've been able to reboot and rejoin us.
Diolch, Jan, Rhiannon Bonewood, Executive Director, Quality Nursing Hours, Health Professionals. Thank you. Yes, I'm glad too. Thanks, Jan. So yes, I will take it as read. I think just to state though, obviously strategic risks are those that would be the ones to knock us over in terms of being able to deliver our strategic objectives. And I think it's really important to make the point that our corporate risk register is also a very key risk piece of architecture, which also obviously holds very important key risks. And I'm making that point deliberately because I think obviously some of the risks that may have appeared in the strategic domain will be proposed to be identified within the corporate risk register. So yes, we have had several discussions on these as an executive team. Obviously a lot of cross-cutting themes were identified, and that's the way we've approached it. And obviously we've also had discussions with the wider board as well. There is one change to the second risk in terms of where it talks about there is a risk that we won't deliver high excellent services. It is proposed that we replace the words there with high quality, safe and effective services. And the reason for that is obviously having the risk around quality is really important and is a different distinction than the ambition of excellence. So that's our sort of rationale around that. So we would like to propose these risks to become our new 6 strategic risks for the strategic risk register. Thanks, John.
Okay, Diolch. So I'm going to open up then for any issues, comments, queries at this point. Kate? Yeah, dros y chi.
Diolch yn fawr, Jan. And thanks very much, Rhiannon, for that. completely support the proposal to just change that terminology there, because I think it is about a risk descriptor, isn't it, rather than the ambition of where we want our services to be. So I'm completely in favour of that. I think these look a lot more like we would want them to. I think these are probably the main descriptors of the risks that we are facing as an organisation at the moment. So I'm comfortable with these, and I'm just looking forward to seeing how we can kind of operationalise them now through the committee structure. Can I just ask, given the fact that we have revised these quite recently, what opportunity do we have to sort of monitor how we can implement and track these, and then maybe refresh or revise them in the next sort of quarter or 6 months or so? Thanks.
Do you want me to take them as we go, Jan? Okay. Diolch, Kate. I mean, obviously risk is dynamic, so we should approach risk in that way. We are very keen to keep working with Nathan's team in terms of what we can realise onto the performance and assurance dashboard. At the moment, we only have the corporate risks that are visible in that space, but we obviously are working towards that. That is the aim. So I think revision, absolutely. But I mean, what will be key is the controls and the actions. So, the committee's role very much will be for the relevant strategic risks that they are tracking, that those actions are happening. So I think that's as important as anything, isn't it? The controls and the actions actually to help mitigate the risks.
Okay, Kate. Thank you. And Mohammed, you'd like to come in there?
Thank you, Jan. Yeah, I mean, can I agree with Kate that these strategic risks seem to be set at the right level and are aligned to the plan, which is good to see. I'm particularly pleased that we have picked up as a strategic risk our ability to deliver a big change program. I think we mustn't underestimate how big that is. It was big before the plan, and the plan includes additional, possibly significant change. So we do need to grab a hold of that and set out what those big changes are and manage them more strategically. And I would like to see references to the strategic risk as we develop those plans, to what extent proposals are affecting this risk. So I really like that. On the other hand, one or two little things maybe I'm less clear about. I don't immediately see the emerging geopolitical situation as posing a risk to our ability to deliver. It may be that needs a little bit of expanding. And as you know, I'm sort of challenging of risks that may not affect our organizations are just out there in the wider world. So I don't quite see that link, but on the whole, I am very on board with the proposals as they're set out here.
Thank you. Thank you, Mohammed. We'll come back to that point, I'm sure, because Tracy wants to come in and make a comment there.
Yes, thank you, Jan. Just building on what Rhiannon said in Kate's question, of course, as part of our review of the long-term strategy, we will actually need to review the strategic risks once more and set risk appetite for them as well. So wherever we get to with the long-term strategy, there will be a series of new strategic priorities that may or may not be similar to our transitional plan. So that's an ideal opportunity for us to take stock and look at that. Setting risk appetite for those when we finalise those are going to be really important as well. But really, until we have the new longer-term strategy, that's the time really for us to be focusing around the risk appetite. Just on Mohammed's point, I think it's really more that geopolitical element is in recognition that already we've got quite a considerable amount of work from the stuff that's happening in Ukraine. Firstly directly, and then we'll give an update on the work that we're doing weekly and within the organisation across the UK and also internationally, on which I'll pick up in my Chief Executive's report. But also, Mohammed, it plays to the concerns that can have on income poverty, the impact it can have around fuel charges against what's already a very, very challenging energy situation that from tomorrow will kick in for many people, and so it's that some of this is about the indirect elements that may need us to change some of the trajectory around what we're doing around the broader population health arms, not just the health, perhaps health protection and business continuity. I hope that's helpful. And as we will review, we may get 6 months down the line and feel that actually we don't need that risk anymore, or it needs to change.
And I think following on from that, Tracy, I think, Mohammed, this speaks to our role as the Public Health Institute, because it's a commentary on sort of the wider implications of what may be happening a long way away from us in terms of impact on our population that we need to flag to government particularly. Could I ask one point, please, on the risks myself? There's a reference to risks around ongoing COVID-19 response and supporting staff well-being becoming a corporate risk rather than a strategic risk. And yet strategic risk 3 concerns not managing organisational change well, and there's reference to an exhausted workforce, etc. So I'd suggest that we won't manage organisational change well if we don't pay attention to staff health and well-being. So could I ask that you just think about reframing that, please? Because I think it's something that the board would really want to keep strategic oversight of in year, given that we're still in the middle of a significant organisational change programme. Is that okay? Can I ask you to take that away and think about?
Absolutely, Jan. Probably just to respond quickly, I think it was just acknowledged a significant amount of work has gone on in embedding support around the health and well-being of our staff. And things going to the corporate risk register, I guess, isn't seen as a kind of lesser importance. It's just a different way of approaching it, but we can certainly give that some further thought. Thanks.
Thank you. So are we happy with those comments? We're happy to say that we approve these strategic risks for inclusion in the IMTP. And can I ask committee chairs to think about the mapping across of the risks to your committee work, please? I'm very much picking up Tracy's point that these will be subject to further review, as will our overall approach to our risk appetite as part of the long-term strategy refresh. So, Rhiannon, thank you very much for taking us through that and for all the work that I know the executive and colleagues have done in reframing the strategic risks. So, Hugh, the last part of our IMTP debate then is our budget strategy. So back to you, please.
Thank you, Jan. Maybe in a slightly different manner from colleagues who may be doing this in other public sector organisations this week, I'm going to present this in quite an optimistic way, actually. I think there's a journey that you'll follow through this paper, and I won't go through the paper page by page and table by table, but you'll see how our income is constructed for next year, what our baseline costs are and what the cost pressures we're facing. And I think the key issues for me is, actually, I think we are grateful for the allocation we've received from Welsh Government. It is one of the more generous allocations in my career. We've had an uplift of 2.8% to our baseline. We've had a number of issues funded on a recurring basis where they were funded in the first instance during COVID. So those are issues like the pay costs of the turnaround times in the hot labs, IP5, for example. We've got a number of items where they've identified they'll reimburse us costs next year, so they'll be neutral to us. For example, the ongoing testing costs. So that helps us to a great deal in terms of the risks that this plan encompasses. The organisation's worked very, very hard over a number of years now to make sure that we don't ever go into the new financial year with an underlying financial deficit. So therefore, we would break even this year. We're starting on an underlying break-even position, and that means that we can take full advantage of the uplifts we've been given by Welsh Government. So you'll see that how we allocate the 2.8%. You'll see that in the table 5 and then table 7, some of the sort of analysis in terms of the allocation, some of the pressures that, excuse me, some of the pressures we're facing as an organisation. You'll see that actually things like the increased Microsoft costs, the increased rent and rates, the increased inflation costs, those are all funded within this strategy. So I think the important thing to get to is We've made a number of decisions as an exec team this year. The first of those is we are not asking our directorates to make a savings target at the start of this year. We accept that people are only just returning to their normal roles. We accept that people are resitting directorates, and the ambition that we've been talking about in the earlier part of this conversation, the IMTP, puts a considerable pressure on people. To say to somebody, go back to a role that you've not done for 2 years and find us a saving would be unreasonable and doesn't seem a sensible way forward. So we're not asking people to make savings at that stage. But I'm looking at the allocation in years to come. It's a 3-year settlement. It's going to be a lot tougher next year and even tougher the year afterwards. Therefore, one of the challenges we've got this year is to critically appraise ourselves of our underlying financial position, to look at where we can move resources to meet our priorities and where we can achieve best value. So that's what we'll be doing in year. And we've set up a number of new mechanisms. One is a very, I was going to use the word aggressive, I don't mean that in the wrong way, but a very detailed review on a quarterly basis of our financial position with a view to, does that give us opportunities? We'll do a half-year review as well, so that's really important. I think the positive note I'll end on in terms of the revenue budgets, you'll see on here in table 7 that we've identified both a recurring and a non-recurring investment pot. I think that's a sort of a brilliant position for an organisation like ours to be in. Yeah, the figures aren't huge, but they shouldn't be looked at as sort of not significant. £1.3 million on a recurring basis and £500,000, which we're targeting towards how we can improve, how we can change, how we can pump pride in future change. Total investment of just under £2 million. The executive team have been going through a lot of work recently to actually look at how we can prioritise that investment, how we can target that investment. And actually, Tracy wrote to all the executives earlier this week with her final decision on allocation of that investment, which will form part of your next finance reports as we go forward. But I think that's exciting, and that is actually a considerable achievement for the organisation. But it puts us in a very good. And when I said I'm going to do a positive financial report, a positive financial strategy, I think it must be borne in mind that we are managing cost pressures in this. We have an underwritten agreement from Welsh Government in terms of some of the COVID testing costs. Welsh Government will fully fund the new wage awards, whatever they are in Wales. And there's also been a recent letter from the Director General Chief Exec, given some degree of certainty and comfort to chief executives in terms of increasing energy costs should those sort of become a major pressure, which obviously they are. So I think we're in a very stable position there, and then we're able to invest. So that's in terms of the revenue position. Maybe the slightly more negative part is the capital position. Capital is under a huge pressure in NHS Wales going into this next year. The ability to pull down new strategic capital is limited, and therefore, I mean, it's very pleasing that things like the breast screening next phase of work have already been approved for next year, which I think is important. But I think the pressure comes in terms of our discretionary capital. Our discretionary capital is that amount that we get given every year to spend as we please, essentially for a replacement capital programme. Like all organisations in Wales, we saw, and we didn't expect, I must be honest, we saw a 24% cut in our discretionary capital for next year. That is a pressure. That puts us in a situation whereby we will have to make some hard choices in terms of prioritisation. But the exec team are working on that. We are taking that forward, and we are sticking to some of the commitments that we do, or the commitments which we had already made in the previous financial year going forward. Things like the work we're doing on our North Wales estate, for example, that will continue. So it will put us in a difficult position. I think, again, trying to put an optimistic view on that, we have been lucky in terms of our services, both microbiology and screening, through COVID and through this modernisation work. They have had considerable investment from Welsh Government in recent years. So we're not starting with a sort of dilapidated, outworn equipment base, but we do know that our ability to manage in year, and actually it links to some of the conversations that Ian was bringing in terms of digital, our ability is less than we expect it to be, and it will be a challenge going forward. So I think I'm going to work on that basis, Jan. A quick overview for everybody in terms of how the plan works. The detail and following it through is hopefully in the paper and people can follow that. But I suppose, from my point of view, I'm recommending to the board a balanced budget for next year. A balanced budget which I feel covers our risks, covers a number of our cost pressures, but also gives us the ability to invest, which is really important going forward. But there is obviously the challenges around the discretionary capital. So thank you, Jen.
Thank you, Hugh. And we will have the opportunity through the integrated performance report when we're looking at the month 11 position, to comment on the sheer hard work, the rigour, the drive that goes into achieving break-even every year. And as you said, that gives us the opportunity to start off the IMTP from a good baseline, which we always comment on in terms of congratulating everybody who's involved in that across the organisation, because ours is an envied track record in terms of maintaining financial discipline and break even. So I'll open it up now to ask for any questions or queries at this point. Mohammed, you wanted to come in there.
Thank you, Jan. And thank you, Hugh, for the optimistic assessment of our finances. It's a pleasure to listen to that, because, as you know, that's not the case everywhere, and it's really good to hear. And I know it's mainly to do with the way in which you and colleagues in Public Health Wales actually manage the finances, that we're able to bring in the balance year after year. It's a fantastic achievement. My question was the extent to which your assessment is aligned to the medium-term financial plan, and what assumptions can we make about our ability to deliver our commitments in the plan with respect to the finances that are available. So we've talked about our aspiration to deliver excellent services, but we've also talked about how tight capital funding is. Are we saying that those things have been costed and we can afford them? Or are we saying that we will consider those things as resources are made available year on year and they may or may not change? What is the general approach?
Should I answer that, Jan, before we go on to the next question? I'll answer them slightly in reverse order, Mohammed, because I think they flow slightly in that way. What assumptions can we make? We've made the assumption on the basis that the IMTP is prepared on the basis of the resources that people currently have. Therefore, the IMTP was made on the basis of no investment. However, we've got the £1.3.5 million worth of investment. So that should enhance it. It should actually give us more confidence of achieving it, and it should give us the ability to at times maybe achieve better or quicker. But I mean, it is very much the plan, and we've said to ourselves all the way through that whatever we put in the plan, we have to be able to do from existing resources. So I think that's important. I think just linking to that, your capital point, and it links to Men's explanation earlier of excellent services. I think, I mean, again, I've never really been in this position in my career that actually we've almost seen a large element of our equipment estate in both microbiology and screening replaced very, very recently, or agreed to be replaced. It's a benefit of COVID. We had an awful lot of equipment that maybe we wouldn't have expected 2 years ago, going back to David's earlier question. Therefore, that puts us in a much better position. And so there will be times technology changes. I mean, microbiology always amazes me how quickly it moves on. So there will be times when we're making cases or we're having to look at reprioritising, but we're not starting from a baseline of equipment whereby we've got concerns, I think. Personally, I think things like we've committed in terms of our North Wales estate. I think that's an area where we would have concerns. We are looking at a longer term strategy for our labs. Some of those, as Meg and I were talking earlier this morning, some of those are not what we want them to be. So that's another sort of strategic view in the future. But again, we haven't got the money for that as we stand. Alignment of the investments, absolutely entirely aligned to the IMTP. So we've worked together as an exec team for a number of months now. We had general conversations. And in fairness to Tracy, she set out the themes which she was looking for investment bids on. How they improve population health. how they improved our digital knowledge services and our knowledge, how they ensured that the organisation was equipped and stable enough to deliver the IMTP on an infrastructure basis. So those things were clearly set out. We all bid, we all saw each other's, we all critically assessed each other's, and being really blunt about it, nothing was funded which doesn't align to our IMTP, so there shouldn't be anything in there that doesn't feel as part of that. So hopefully that helps.
That's great, really clear. Thank you, Hugh.
Thank you, Hugh. And David, you'd like to come in, Joseph, Hugh?
Good morning, Jan, and thanks, Hugh. Just wanted to emphasise, I think we're in a very good place in terms of our financial planning, financial planning supported by the government, puts it on a very good platform, and of course we've got a great team ensuring that we get the appropriate support. I think it's important to recognise now we're going into a different period, a different phase tied into this IMTP. We've shown how flexible we have been able to be in everything, including finances in the past couple of years, and being able to produce savings and everything else. Now we're going to a stage where there's, dare I say, there's going to be a bit more strict control, and there's going to be a real tie-in to what we're trying to achieve in terms of outcomes. So there's almost a bit of a cultural shift there, I think, and that may be something worth noting. The other thing I think is worth noting on capital, as Hugh said, it's more problematic. Perhaps also it provides us with an opportunity, notwithstanding the great need to upgrade facilities in the Great North, if I can declare that interest, but also looking to see what we can do in terms of the states, what it means in terms of new ways of working. We're also aware of Welsh Government ambition to have less people travelling to work in order to contribute to climate change agenda, and also an opportunity to work collaboratively so that the space we create isn't just ours maybe. There's an opportunity there, perhaps we can reflect in the IMTP to look at possibilities. Not a nailed down plan, Jan, but something we can explore, taking advantage of the new policy agenda.
Yeah. Hugh, was there anything you wanted to come back on before we conclude? And we'll certainly pick up David's point accordingly.
Pick that up.
Thank you. So we're going to conclude that session now. So we've had a detailed run through the basis of the IMTP that's going to be submitted tomorrow. And for those of you looking in online, this clearly is the product of many, many hours work. And non-executives have had the opportunity to look at previous drafts and to comment on them. But as Tracy said earlier, Hugh, Nathan and the whole team involved in pulling what is an exceptional plan together in the context that we're in, looking across the breadth of the organisation, and as we heard before lunch, really richly informed by the learning and the impact of the last 2 years. And it was helpful to have that conversation, otherwise we may not have captured that, which we will do in the minutes. So I'm asking you now then to approve the IMTP as you have it in the papers. There will be some changes made, and Nathan and Hugh will issue us with a note tomorrow afternoon to that effect in terms of the changes that have been made. So on that basis, are you happy to approve the plan and to send our warmest congratulations from Gyfachiad Mawr to all those involved in its production?
Yes and yes.
Yeah. Thank you, Hugh. Thank you, Nathan. I hope it's not too much burning midnight on now in terms of the notes. So we continue now with our board assurance framework section, item 7. And Tracy, we hand over to you, please, for your chief executive report.
Diolch, Jan. In the interest of time, I'll take it as read, but just to flag a couple of items. On the Ukraine situation, I've just shared some of the international work that we're doing, and Meng in his in the next item, we'll give an update on how the organisation is directly involved around the current challenges in Ukraine. To note, the draft terms of reference inquiry have been published, and obviously we stand ready to support the inquiry in every way over the coming months and going into, no doubt, a year or years. Really delighted around item 5, which is our Stonewall Workplace Equality Index. Diversity and inclusion is so important to us, board and colleagues who are not within the organisation who may be watching. We had a session this morning in private where we heard our women's network, for example. So our networks are really important to us, as is our Embedding network, who are fantastic in really supporting our LGBTQ plus wonderful people across the organisation. So we were delighted that we've moved in Stonewall Workplace Equality Index from 100 to 64th place, just announced a number of weeks ago. But not only that, for the last year, because obviously it's a year behind, we were awarded a gold employer status, and then to top it all, we were notified that we were ranked 6th across healthcare organisations in the index across the UK. So just really delighted, and really that so much of that is down to the commitment and the passion of the board, but particularly from Sarah Morgan and our wonderful Embedding network, who just been fantastic in letting people be themselves when they come to work, and just advising us on the kind of things that we need to do to improve that. And then the final comment, and I'll just invite Meg, if I may, just to give a little bit of an update, was just on the update on the review of TB in Hendy, and the items just about let people know about a short delay. And so if that's okay, Jan, I'll ask Meg just to give an explanation of that.
Fine, thank you. Over to you, Meg. Diolch i chi.
Diolch, Jan and Tracy. So in terms of response to the ongoing conflict in Ukraine and the arrival of refugees seeking sanctuary in Wales, we are working very closely with our partners in health boards and local authorities, coordinated by Welsh Government, so that we take a holistic approach to address the health needs of individuals in those unfortunate circumstances. I think the most coordinated approach is our offer of support to those coming into reception centres across Wales, where we work very closely with our health boards to align the pathways of testing and treatment for those individuals. And we have been providing advice to Welsh Government in relation to the risk assessment, particularly around threats from infectious diseases, with our understanding of the in-country prevalence of some of those diseases in Ukraine. And key to that are levels of TB, which are thought to be high prevalent areas with a high degree of multi-drug resistant TB. We also understand there are threats from bloodborne viruses such as HIV, hepatitis B and hepatitis C. So the advice is we offer screening for TB and those bloodborne viruses mentioned, in addition to updating the immunisation schedule, where the uptake on vaccinations, including COVID, polio and measles particularly, are some things that we need to focus on. We will bring people up to speed with their immunisation programme to align with what we have in Wales, which I think will put us in a really good foundation of ensuring that the risk of transmission of infectious diseases is kept at a minimum. So that work is ongoing, and we'll keep the board updated on progress with that. But you know, we are offering credible and trusted advice on health protection. Clearly, the holistic nature of health needs of that vulnerable group is such that we also need to address the mental health issues and the trauma related issues, and we stand ready to provide support as and when Welsh Government seek that from us. Moving on then to the Hendy TB external review that we commissioned in August last year. In September, we asked the board for approval of the terms of reference, and we initiated the external review shortly thereafter. And we informed those directly affected about the review and the suggested timescales, which at the time was to bring report back to board in the main meeting, but the timelines are such that owing to the delays, some of which was due to the Omicron variant, which meant we weren't able to prioritize some of the groundwork needed for that, but also the fact that the review was initially initiated in 2020 before the pandemic, but was put on pause, that many of the review panel that was put together at the time, some of them have had different roles, and therefore we've had to look for alternative members. Pleased to say that the review panel is now complete and the work can continue now that all the contractual basis has also been sorted to ensure that we've got a robust information governance framework in place. Now, at this stage, it's difficult to say exactly when the report will come back to board, but we're looking at later in the year.
Thank you very much, Meng. And in respect of the support for people coming in from Ukraine, of course, Wales is a nation of sanctuary. We're very proud to have that status, and we in Public Health Wales, particularly with your team's involvement, will play our full part in discharging that role as a nation of sanctuary. So thank you very much for that update. So Tracy's report is there for assurance. I know that Kate wants to come in first, and then Judy. Kate, possibly here.
Diolch, Jan, and thank you very much, Tracy. And first of all, just to say, fantastic results on the Stonewall Index. That's a huge achievement over the past few years. So very well done to everybody who's been involved in that, and also your leadership from the top. It really has been wonderful. Can I just make a quick comment on number 5, which is the Trauma-Informed Wales, the consultation that's out. As you know, I chair Welsh Health Specialised Services. We house Traumatic Stress Wales, who were the partner for the ACE Hub in developing this piece of work. And I know Professor John Bisson, who co-chaired the expert reference group alongside our very own Joe Hopkins, just wanted me to extend his thanks to all of the team at PHW for a fantastic piece of work. Certainly we feel that the expert reference group, which was multi-stakeholder and cross-sector with representation from people with lived experience of adversity and trauma, was a real model for developing this type of work. So I just hope it provides a platform for future collaboration between our two organisations. So a very well done to everybody who's been involved in that. Thank you.
Thank you. That's the same point on which I want to bring in Judy. I know she's put in the chat bar to say well done to everyone, but I think it's our opportunity to say well done to Judy in respect of where we find ourselves in the Stonewall Index, because Judy, you have championed this agenda throughout your time on the board. You have been an inspiration, you have been a driving force, and we wouldn't be where we are today without the benefit of your expertise, your support, and your constant motivation of the team. So diolch yn fawr iawn I chi. It's one of your legacies to this board amongst many others.
Thank you very much, Jan, and apologies, my camera doesn't appear to be working just now, but I mean, all the credit should go to Sarah Morgan and her team, actually. And Sarah has been wonderful to work with. She's been a fantastic member of this organisation, and I'm really, really proud, to be part of that and to be able to play my part in it. So, congratulations.
Thank you, Judy. And Tracy, the board will take assurance from your report, and we move on then now to 7.2, and then it's back to you, please, for an update on COVID-19 and any other matters you want to raise.
Diolch, Jan. So in terms of the current epidemiology for COVID-19, I think we're seeing a slightly undulating plateau in cases. Looking at the daily cases over recent 2 or 3 days, the numbers are coming down in absolute terms. When you look at the trend, I think we've gone beyond this slight peak. And I think this peak is explained by the emergence of the BA2 sublineage of Omicron variant. And this sublineage behaves in a slightly different way. It seems to be more transmissible than sublineage 1. of the Omicron variant, but the reassurance that we have is that looking at the hospital admissions, it doesn't seem to have translated into a higher incidence of hospital admissions or critical care admissions. So what we're seeing around the world, where Omicron BA2 sublineage has had an impact, is that despite lifting restrictions, some of the rises in hospital admissions have been modest. And I think this has informed recent Welsh Government policy about further lifting of restrictions that was announced last week. So we continue to monitor the trends, but just to note that BA2 sublineage is now the dominant variant. It's over 70% of cases where we are able to comment on the genotype of the variant. So this gives us some assurance that we are heading downwards in terms of the trends of COVID. Clearly, we need to build our plans for future surveillance so that in the absence of widespread testing, and you will note the announcement about the reduction in availability of testing, particularly for community cases, with effect from tomorrow, that will have an impact on our ability to monitor some of those rates in our community. However, we are planning our surveillance programme so that we establish sentinel surveillance across Wales to give us a mechanism for looking at the true community rates and estimating the trends over time. We also know that the ONS survey gives us another source of information to look at ongoing trends. We will continue to commit to testing for symptomatic cases that go into hospitals, and will offer our multiplex tests so that we can test over a range of respiratory pathogens. And I think the direction of travel is to very much align COVID surveillance with the surveillance of other respiratory illnesses such as influenza and RSV. In terms of non-COVID incidents and outbreaks, we are continuing to deal with several TB clusters across the country, and we are exploring the impact of single cases on those contacts that are closest to them in a variety of settings, some in the community, some in educational settings, and we're starting to get the whole picture about the transmission routes. Now, our knowledge of TB is such that it's the prolonged close contact that results in transmission of tuberculosis, which is why we often apply a risk-assessed approach to screening. We've mentioned the Llwynhendy outbreak, which is ongoing, and we continue to ask people to come forward for screening so that we can detect whether there's a latent tuberculosis present and offer treatment accordingly. Other non-COVID incidents include some examples where potentially there may be transmission from animals to humans and vice versa. So we are currently investigating an outbreak amongst cattle of human tuberculosis. And this, I think, highlights the need for us to establish closer relationships with the Chief Veterinary Officer. And we've begun those conversations to understand how we can strengthen our surveillance for animal pathogens and human pathogens and make the links. And I think our potential is to explore how our genomic sequencing capacity can offer in this space of controlling zoonotic transmission in this way. So I'm happy to stop there, Jan, and take any questions.
Thank you. Now, that was a comprehensive run through that agenda. Are there any questions or queries for me, please? No, so thank you very much. Now we can take great assurance from that update you've given us, and we will be hearing more about the full agenda in our forthcoming meetings. Diolch yn fawr iawn. So Hugh, we turn back to you then for the integrated performance report and our month 11 position, please.
Thank you, Jan. In terms of how we handle this today, our suggestion is going to be we handle it slightly different than we have in previous months, so that we don't necessarily go through each of the lead directors and bringing out all the key points, just because we're very tight on time. The report is a familiar format. It has actually those key points. The way we now present the start of the report, all those key points are actually brought forward for you, the directors are part of, so you can see those. We're assuming that everybody's read that. So I think I would suggest, I need to spend 2 minutes on the financial report because we're reaching the year end, obviously, but I suggest that before we do that, we take the performance report as a whole, and then we open it up in terms of questions, maybe in terms of each of the sections, and we deal with it in that way.
People content with that? Yes. So Hugh, that's fine.
Okay. So, I mean, are there any questions on the people sections? Any questions of Neil in the first instance? I can't see any hands going up, so. No.
Well, I think as well, there's recently been a People and Organisational Development Committee meeting as well. So that's very close to the board on the people issues.
And I think the point I was trying to make at the start, issues don't tend to crop up in a month. They tend to be issues that arise over a period of time. So many of these conversations we've been having for a number of months now, haven't we? So we've discussed a lot of the indicators in detail. So if I move on, any questions of Meng in terms of the services and the indicators, quality indicators that Meng is responsible for?
Yeah, we're okay on that.
Any further points of Rhiannon in terms of the quality complaints, etc.?
Rhiannon, may I pick up a couple of points with you? One concerns the contract that we've let for a climate change survey. I know it's in a different directorate, it's not in your directorate. I just wanted to pick up in terms of when we go out to tender for surveys that will have public involvement, public engagement, and given our responsibilities under the Welsh language standards, and for example, British Sign Language, which we talked about before, can you just talk us through what provisions are we making, perhaps as part of our refreshed approach to public engagement, to make sure that we have those requirements covered, please?
Can't get the...
You can't get in again? Oh, I'm sorry. Might you be able to come in there on that point, because I'm having terrible IT difficulties. Would you like to come in there?
Absolutely, Jan. I can come in on that point. So this was something that we recently took to the business exec team as well. We have got an action plan in place for this, Jan and colleagues as well, but this is something as part of the procurement process that is picked up and covered off. There are a number of specific questions around the Welsh language and our expectations, and also in terms of the organisations we're working with, they've clearly got scripts, and we are, as part of the work that they're doing, Jan, as well, we are reviewing and sense checking what that looks like, just to make sure they are compliant and following the standards which have been set out.
Thank you very much, Neil. And I think Kate wants to follow on with a question around that. And Rhiannon, you may have to just put a response in the chat bar to that if we can't connect with you. Yeah. So, Kate, just a biggie.
Yeah, thanks very much for that. And yes, it is something that we have been concerned about in Quality, Safety and Improvement Committee. My question actually is on one of the incidents that we're making reference to the report here, and it's the Diabetic Eye Screening incident that's been open since 2019. We know that we have been tracking this through QSIC, but given that this is a public board meeting, I'm just a bit uncomfortable with the fact that this has been open for 3 years now, and we don't have a sort of anticipated closure date for it. So perhaps you could say a little bit more on when we intend we might be reaching closure on this one. Thank you.
Diolch, Kate. I'm going to try. It's opened. I've left it open. I don't know what's going on today. Sorry. Just to reinforce Neil's comment, we are also looking at establishing an experience and learning group, which is all about the engagement work stream, which we were asked to strengthen the governance arrangements anyway around all our kind of approaches to engagement in terms of protected characteristics. So that's as well as the point that Neil made. Sorry. To come back to Kate's point, yes, Kate. So I am aware. I hope you can hear me because I can hear distortion on the line. I am aware that this was quite a complex situation whereby we had to actually get consultant ophthalmologists to assess for harm, and obviously there was quite a big number of people, when I say that, about 53 I think, that needed to be assessed. So that required a clinic assessment, and clearly there's been challenges with getting clinic appointments, etc. So what I can tell you is that we've got down to 11 now of the original cohort. There has been no identified harm to date, and we are told by Diabetic Eye Screening that this should be completed by June of this year. So that's the update on that, Kate. So we hope to get closure in June. Okay.
Thanks very much.
Thank you, Kate. And perhaps the next meeting of QSIC, if you can just keep tracking that, and I'm sure Brianna will supply the information. Deal. So Hugh, shall we come back to you then in respect of financial position?
Yeah, I mean, I think I'll bring across a couple of things. We're actually on the last day of March now. So Andrew and the finance team are most probably spending every minute of the day at the moment, as they have been for weeks now, following items through, making sure that everything gets progressed in the year end. We are still forecasting a balanced year end position. Obviously, there always involves a bit of management of that at the year end to make sure that all the plans go through according to what we expected. But I think in terms of the board assurance at this moment in time, it's important that you take that assurance. We report that position to yourselves every month, obviously, but as you notice at the start of the finance reports, I always refer to the fact that it's reported to Welsh Government, and that's part of our formal scrutiny process. Welsh Government review all our monitor returns in great detail. They also ask us to confirm that actually that what we tell you and the board is what we tell them. That sounds very simple, but it's quite an important point. So they are scrutinising the same as you are scrutinising. Each month we get a reply from Welsh Government. Those replies at times could be a letter with quite a few points, things they want us to address, questions they got or challenges they got. Other times, and most probably the most common response we get at Public Health Wales is just an email acknowledging it, at times saying no comments to make, or maybe just making a few small comments about can you move this from one line to another, here's your updated capital resource limit, those sorts of things. So just to assure board members that scrutiny continues, and really I suppose complements the scrutiny that goes through in terms of our board, which is important. So yeah, at the latest we had a month 11 was an email response, no major points, and I can it was brought up last week. I'm quite happy to share those responses through the audit committee in next year as we do as part of the monthly monitoring. The more challenging part of the year end, you'd think from the report, is obviously the capital. And I'm aware that the challenge that board members have put to us over recent months in terms of our confidence levels around the capital and the delivery of the capital each position at year end. And I think most probably importantly, what learning we can make from that going forward as well. I think there's a couple of issues in there. We've put a new column in the capital table which give you comments. And you can see that actually what we've said there is requisitions are now being made, all invoices or most invoices, so you can see the degree of confidence. There were a couple of issues where we had capital allocations late-ish in the year, not on the 1st of April of the year. So actually the whole process, and these tend to be pretty large figures. For example, there's sort of the issues around breast screening was a major procurement exercise. The multi-TOFs, which the board approved recently, there was a procurement challenge, which is not unusual, but actually that puts everything on hold. But the position that we present here is, yeah, there will always be risk around a year-end position, but I think I'm giving you confidence at the moment from what we can see, everything should be landing at the year-end. We should be taking ownership of all those assets which we were planning to by the year end. And I'm confident we'll achieve that as well. So that's just a really that overview I wanted to give you, but also really linking that sort of confidence around the scrutiny that we get from Welsh Government that I'm not sure everybody was always aware of. I hadn't most probably explained that clearly enough in the past. So that's any questions.
Thank you very much, Hugh, for that detailed exposition. And David, I'm sure it would be helpful for Audit Committee to have a synopsis of those Welsh Government financial commentaries, won't it? Because they go in every month. So Hugh, thank you very much for that. That would be really helpful for the committee. So are there any other points, any questions for Hugh as we come to land the year end and all the complexities that Hugh has outlined? No, so we're happy to take the recommendations that are set out in the paper. Hugh's given us a detailed exposition on the surplus we find now at month 11 and our plans to break even. Where we are with the capital programme, I mean, we won't have such a volume of capital spend next year, will we? But we, obviously lessons from this year have been learned. And then, of course, as always, we do note the balance sheet. So on that basis, we can take assurance and take that confidence that he was asked of us. And clearly as well, we note the issues set out in the wider performance and insight reports. And as ever, committees will be looking to see how much of that overarching report they use in their own committee work. So diolch yn fawr iawn, Hugh. And again, I just reiterate congratulations to everyone who gets us to this very enviable break-even position at each year end. Diolch yn fawr. Just, we cannot underestimate the complexity involved with that. So with that then, we move to our last agenda item, which are committees of the board. And we've had written updates from Quality, Safety and Improvement and then People and Organisational Development. So Kate, shall I turn to you first, please, in terms of matters you want to bring to the full board's attention?
Yeah, diolch. I think there's one item really, which is just for the board's information updates on our approach to engagement, looking at how we engage with feedback from our service users at the last QSIP meeting a couple of weeks ago. And we approved a proposed refresh and refocus for year 2 of that strategy. So we were really pleased with the proposed approach that we saw. It includes the use of a new database called Civica, which will hopefully help us more systematically and consistently collect and interrogate the feedback that we're getting. So as I said, committee were very happy with what they heard, and we just emphasised the need to keep the focus on population health and inequalities through that work. So that's all I was going to say, Jan.
Thank you very much, Kate. Before I open it up for any comments, can I just ask, about the points that Sally Holland made this morning about engagement with children and young people? Does the work that you've set in train encompass that already, or are the issues she raised this morning ones that you will need to now go on and take into account?
Yeah, I think we need to take another look at it through the lens of children and young people, Jan, because I was particularly struck by some of the comments that Sally was making about the need to specifically look at our communications materials through the perspective of young people, with a view to their kind of enhanced awareness and understanding of some of these things and their need for a greater clarification and explanation of some of the things that we as a health service and system are planning to do to them with their permission, but with their full understanding as well. So I'd like to take another look at that.
Thank you, Kate. That would be really helpful, and we'll remit that to Quality, Safety and Improvement. So we have another written report in respect of People and Organisational Development Committee, and then I will ask David and Sean whether they want to make any verbal updates from their recent committee meeting. So Mohammed, over to you, please.
Thank you, Jan. I think the paper summarises our meeting quite well and succinctly, so I won't repeat what's there. Perhaps just expand a little bit on the work we did on diversity and inclusion, because pre-pandemic, this was a standing item on POD, and we have reinstated them. So we are now having a systematic look at diversity and inclusion across the organisation. And at the last meeting, we had a very detailed look at our progress against year 2, and actually spend more time on it than we had allocated because of the level of interest there is on the issue. So that will come back at each meeting. A particular issue that came up, which I thought might be worth mentioning in terms of encouragement from us, is there are still pockets where people are hesitant about calling things out or speaking up. And we heard about, 1 or 2 examples where people felt that maybe the climate wasn't right for them to do so. And we certainly emphasise that that's what the board wants, and that's what, certainly the pod wants. And we want to create that culture where people can call out discriminatory practices or behaviours. And so we talked a lot about that, and we will come back to that theme again to ensure that the level of commitment that we often express at this level cascades right the way through the organisation.
Thank you, Mohammed, and we look forward to hearing more of that in this coming year. David, anything you want to bring to the board's attention?
Diolch, Jan. I think we've covered some of the points in the meeting anyway, so we'll have an update written report next time.
Okay, diolch, David. And Sian, is there anything you'd like to bring to the board's attention from Knowledge, Research and Information Committee meeting, please?
No, I think we've heard from Ian already today about the new approach that he's trying to engender, and we reported last time we're still in the process of mapping, and we'll come back to you with further developments at a further meeting. So thanks, Jan.
Okay, diolch, Sian. Well, that brings us to the end of our formal meeting, but before we close the board meeting today, we just need to pay tribute to Judy Rees, our board member who leads us today. And Judy, I just want to say from the chair's perspective, you are the consummate non-executive director. You are always fully prepared for meetings. You know exactly what you want to ask. You're very concise and insightful in your questions and comments. You have the balance of constructive challenge and support exactly right. This board has benefited greatly from your third sector subject matter expertise, but also your broader corporate experience and expertise, and you have made such a valuable contribution across the breadth of the board's agenda. You exemplify the Nolan principles. You know I regard you as my guardian of the etiquette, and you will always bring to my attention anything you think I need to be aware of in that respect, and you always uphold the values of public health rates. You've been an assiduous committee member. You've been a sterling chair previously of People and Organisation Development Committee, and I think you've chaired meetings of all the committees of which you've been a member during your time with us, and done so with distinction, as you have discharged your whole role in the 5 years that you've been on the board. I do hope that when you look back on your time on the Public Health Wales Board, you will do so with great pride, and you will know just how much affection, respect and regard we all hold you in. So, dan ni'n ddim yn dweud hwyl fawr, a ni dim hwyl am nawr. I'm not going to say goodbye, I'm just going to say bye for now, because we're not going to lose touch. And we know that you'll be looking in on us in terms of the lung health consultation and the screening programme, which is another one of your legacies to us. But I hope you leave us knowing how much you've enriched the work of this board. We hope that we will be friends going into the future, and we wish you well. But leave us with pride for a job so very well done. Diolch yn fawr iawn. Would you like to say something?
I would like to say something just very briefly, really, and just to say that it's been an absolute privilege for me to be part of this board. It's been a wonderful board, very committed, passionate board, and it's been wonderful to be part of it. And I suppose, you know, none of us saw COVID coming, and you know, that obviously took us down a track that I hadn't quite been expecting, and it was very challenging to you know, to be running an organisation myself whilst also being a committed member of this board. But I'm really pleased that I've sort of experienced that, and also being able to be, you know, the guardian of some of the things, as you said, not just the etiquette, but you know, keeping because I'm screening. Really wanted to champion the EDI thing, and that's been my real, I suppose, the pride that I take is about the steps forward that have been made, not just there though, I mean throughout the organisation. It's been absolutely brilliant to see how it's evolved and grown and is absolutely moving in the right direction. So I really just want to say at this point, thank you so much for your leadership. Thank you very much to Tracy for her leadership on the executive. Thank you very much for listening to me and bearing with me, and I really do hope that we will keep in touch. Diolch yn fawr.
So, mae'r cyfarfod ar ben nawr. Diolch yn fawr iawn i chi gyd am eich cyfraniadau. Cymryd ofal, yes? Cymryd ofal a hwyl am nawr. So take care everyone and bye for now. Hwyl am nawr.